How are you? We are free Masithandaze. Almighty God, where you have called us to govern this province, we ask your help to make decisions and laws that will be just and will promote the interests of all the people. Onmachtige God, ons bid dat u gedrende ons vergadrings. Ons dien nou die gewysheid sal gee en ons motiewe suiwer sal hou. En dat u ons sal help om ons te kortkoming te oorkom en al ons besluite aan u op te neem. Sikilela Nkosi ilizwe lethu nabantu balo. Misele Nkosi ukulunga kwiphondo lethu. Nkosi sikilela iAfrika. Gcina abantwana bayo. Khokhela inkokheli zayo. Nika uxolo Nkosi iAfrika. All this we beg in your most holy name. Amen. You may all be seated. Good morning and welcome, honorable members, to the first citizen of the province, the Premier, His Excellency Mr. Allen Winde, honorable members who are virtually connected, and of course, I see here in the chamber It's nice and warm. There's a clump man here. Welcome, honorable members. I will not individually identify you, but I noticed that on my right-hand side, where the DA is sitting, there's many. On the left-hand side, the opposition is sitting led by Honorable Said, so you are alone there. If there is a vote now, so you stand for everyone there. I welcome also the honorable members, your virtual leaders of political parties. You are all welcome. HODs, staff of the Western Cape Parliament, people of the Western Cape, and honored guests. Now we are about to start with the hybrid session. I just want to say, without taking much time, that the statute, which since the April 2020 has been guiding us, is that if you are connected virtually, please behave. Do not press the microphone if you have not been identified by the presiding officer. You must do so by press of the button and lift your hand, or you must just indicate by doing so in the chat room, and you will be recognized. So don't feel that you will not be recognized if you don't speak. Because heckling in terms of Rule 40 and of course in terms of the same directives issued by myself, agreed to by this House, say we may not heckle virtually because it affects the quality of the debates in the House. Now, furthermore, if you are a member of a media, you know the House is House because we work with the media as a very strategic and important partner. But please do not activate your camera, do not activate your microphone. Do what you do when you are in the chamber here up in the gallery, because you are sitting in the gallery, and therefore please observe the rules as such. And everybody else connected virtually, please do not activate any of those as indicated herein above. I'll now recognize the secretary, and the secretary will read the first order of the day.
Ingxoxo-mpikiswano ngevoti yesithandathu engumthetho oyilwayo ongohlahlo lwabiwo-mali lwesebe lempilo eNtshona Kapa.
Enkosi, Mr. Stemen. Honorable members, I now recognize the Honorable Minister of Health, Dr. Mbombo Nuba.
Thank you, Speaker, the Deputy Speaker, Premier, Cabinet Ministers, leaders of the opposition parties, member of the Western Cape Provincial Parliament, the heads of the department, media houses, and the people of the Western Cape. I greeting you in the State of Health Address, SOHA. Speaker, I rise to table the 2022-2023 Western Cape Health Budget of about 29 billion. This is my 8th health budget speech, and in all these past years, I reported on the progress made in implementing the previous budget promises. This year, I want to take this accountability further back in the past 7 years and also share a few progress on promises I made each year. This budget is about journey to health recovery and post-COVID pandemic healing. Vuvulimpilo budget speak. The COVID-19 pandemic has shown us flames and has left our health system more fragile. Not only are we taking care of COVID-wounded society, but you are also psychologically wounded healthcare workers. We all need to heal, not COVID health services have to recover. Let us all come together and rebuild the walls of the healthcare system. Later, Speaker, I will highlight some of the non-COVID health services we are recovering and also our budget commitments to them. Speaker, the 2022-23 budget is not only uvulimpilo, it is also the Ujika Izinto budget. I once reminded this House that we are a Department of Health that focuses on both illness and wellness. We also offer preventive and promotive health services, just as we also offer curative and hospital-based services. Our Western Cape Health 2030 plan, the Road to Wellness, a third Western Cape Health reform after Comprehensive Service Plan 2010, is the long-term strategic vision and direction of the department endorsed by the Provincial Cabinet, just in case people don't remember what was it still here. So, Speaker, we have implemented some of the provisions since 2015. This includes bringing in more preventive and promotive health focus through community-oriented primary care, COPC, a slight shift from a hospice-centric health system, and that we also offer patient-centered quality care with the community's voice being integral. Wellness is defined by the World Health Organization as not merely the absence of disease, but a complete state of physical, mental, and social well-being. Speaker, that's a promise I made in 2015. And also what I said was that delivering a health service will be business unusual. We cannot continue mopping the floor. We have to close the tap by tackling the upstream factors, which means the social determinants of health. Speaker, in 2015, I introduced the new legislation to strengthen the voice of the community to be partners in health service delivery. Uncle Polly Jacobs, the late Uncle Polly Jacobs, who used to be the chair of the Bella Health Forum, wherever you are, Uncle Polly, may give us a sign. We should be happy to see that we didn't only pass the legislation in 2016, because when I passed that legislation, I was dedicating to Uncle Polly. But as of today, all our statutory structures that require community participation, we have made almost 80% of appointments. Not only that, in those structures, the representation is about 50% of community membership. That is mandatory in hospital boards and the clinic committees. So to make sure that we provide the community a voice. Speaker, 2 weeks ago, the Department of Health hosted our Health Indaba to remind us indeed our journey to recover health, Vulimpilo, and recovery is to do business as unusual. And that health is everybody's business. My t-shirt at the back was written like that. I'm proud to announce that we are no longer the Western Cape Department of Health. I need to repeat, we no longer call ourselves the Western Cape Department of Health, but we are remaining ourselves as the Western Cape Department of Health and Wellness, the first and only one in the country. That jigizing. I'm not sure, Speaker, you hear that. The first in the country to be called Department of Health and Wellness, because this journey started long ago. That is the journey that started long ago, and I appreciate that the Premier and the Cabinet has approved that. Speaker, it is in this Western Cape Healthcare 2030 reform that made provision for us to tackle the social determinants of health, with violence prevention as one of those. As health, what lands on our shores is not only health problems, but socioeconomic and political cultural problems that lead to illness and the burden that drains our health system. Premier did announce that there will be a dedicated violence prevention unit that will be established within the department. We do welcome the challenge, Premier. Thank you for providing such opportunity. Actually, in most parts of the world, a public health approach which uses a CADIF model where trauma, morbidity, and mortality data is shared with other sectors for prompt intervention has always been there. Thanks to our HECTIS, HECTIS, the Hospital Emergency Center's Trauma Information System, an innovation we showcase actually in my 2016-17 budget speech, where, if I just a quick reminder, Speaker, that during that budget speech, I made a promise of digital innovations in the health system through the e-vision strategy, which I introduced then. HECTIS was one innovation I bragged about. Others were to develop a unique patient identifier, which we have done that, establishing electronic health records, which we have done that. Now, this HECTIS has been actually escalated to more than 20 of our emergency care centers. Is one that also is helping us to determine the impact of alcohol on our trauma centers and also the impact of mental health in our trauma centers. Now, this tactics is central to gathering the data for the VPU, Violence Prevention Unit. The VPU will utilize data and evidence, develop policy, and work with the relevant stakeholders at the local geographic level to implement measures that reduce violence. It is critical to note that this will not only involve the department only, but will also be a collaborative effort that with all government departments that will need to participate. Actually, Speaker, already we have transversal Western Cape, WOZA, which is the whole of society approach and the whole of government approach that is co-chaired by the HODs of health and also the HOD of safety. We continue what we already started. It's not about something new. When Premier was making an announcement, it's about based on the work that has already been done. This unit will straddle the strategic cluster emergency and clinical support services within the department. This will be the first violence prevention unit to be established in health in South Africa. Can I repeat that, Speaker? This will be the first violence prevention unit in the Department of Health, which is the Department of Health and Wellness, that is established in South Africa as part of social determinants of health. And the money, 10 million rands, that is being committed on this budget. That is Speaker, let me talk briefly about COVID. This pandemic has been brutal to our healthcare workers. As of today, about 209 did not make it. This is tragic, 209. Yes, it may be less than 2%, but we are talking about the faces, about the humans. I convey my words, condolences to their families. May God continue to comfort them. Again, we're talking about the faces of the soldiers that died fighting the COVID battle for you and for me. So we want to, as a department, to be able to say thank you to them. I do want to acknowledge actually Member Van Vogel, who reminded us what about the wall of remembrance for these soldiers, which is we agreed. But because we are still in the waves, because we are coming from the fourth wave, we don't know what's going to happen in the fifth wave and all of those. So it's part of the work in progress that we are looking at. So thank you, Member Van Vogel, for such suggestion. This virus will still be around and is predicted to be around for the next 2 years. Hence the need to reintegrate with other non-COVID healthcare. We cannot run a health system where other health services, non-COVID services, are put on holiday. It cannot be. This virus has taught us that we can be able to maneuver within. People can now access vaccines at their health facilities together with other health services as we decommission more vaccination sites, like, for example, the stadium. So we are integrating COVID within other aspects of the other COVID services. And therefore, in this budget, we are committing about 770,000 so to make sure that we can be able to do that. We also welcome that health regulations will be used to manage the pandemic or endemic, as is always the case with other categories of medically notifiable conditions. I encourage people to engage and make submissions and input to the National Health Department of Health, because now it won't be managed as a disaster, which we do welcome. Speaker, I did mention that I want to showcase some of the non-COVID health services that we want to make sure that we recover. Volimpilo. The province has had to manage more acute mental health admissions in the last 2 years, which is challenging at all levels. The concern is that vulnerable groups, including children and adolescents, elderly patients, and persons with intellectual disability, require tailored management. Last week, I engaged with the Mental Health Review Board, which is the ombuds for mental health users in the provinces, which is each and every province appoint one. They also shared similar concern about mental health users who defaulted treatment and others who came for readmission during the COVID lockdowns. COVID actually has worsened the mental health well-being of the community in general. It is for this reason that the Western Cape identified a need for transversal response to well-being beyond pathologizing the mental health, but as a state of wellness. As is with violence prevention, the HODs of health, the HOD of social development, the HOD of the DCAS, they co-chair this, and this making us sure that at least we focus on the mental health throughout the lifespan and not only as a mental health illness. Weeks ago, we opened an adolescent center of excellence under the Groote Hospital, which provides a full range of social, psychological, psychiatric, and endocrine physical needs for the adolescents. The response to the mental health pressures require a whole of society, a whole of government approach. For example, dealing with substance abuse requires an intensive effort from all of society, not only the health sector, if we are to effectively deal with the impacts of substance abuse on one's mental and physical health. For this budget, we are allocating additional, because health services still have to continue, we are allocating additional 30 million rand for this aspect. This is what we call Vulempilo. Thank you, Speaker. On surgical backlogs, COVID-19 meant that elective surgical services had to be significantly de-escalated as staff were deployed to COVID services, and this resulted in an increase in the backlog of operations. Hence, a specific practicable plan to address this backlog in the short and long term has been developed. We have procured 2 Da Vinci surgical robotic machines for both Groote and Tygerberg Hospital to fast-track these surgeries. Western Cape Health and Wellness now actually is the first one, not only Southern Africa, I think in Africa, for a public health hospital to perform robotic operations. Thank you. And the advantage of robotics is that the system's versatility and its use by multiple surgical specialties will maximize the number of patients who will benefit from this sophisticated medical technology. These robotics will be beneficial in reducing our theater slate, and it is less invasive surgery with low blood loss and with faster and better recovery periods. The main disease conditions that the program will focus on are colorectal, liver, prostate, kidney, and bladder cancers, and women with severe endometriosis. For this, Speaker, for surgical backlogs is additional. We are allocating additional 20 million to recover surgical backlogs. That's what when we talk about Vulempilo recover health, we must put our money where our mouth is. I also want to thank private hospitals for assisting us to reduce some of our theater slates by using their corporate social investment funds to operate free of charge on many of our patients that are waiting for the surgeries. And one in particular, of course, is Mediclinic. But whilst we are talking about that, I just want to showcase, because the people think that these things we just do there and then not necessarily showcase. Here in the house, we have got Mrs. Geis from Eerste Rivier is the first patient to be operated on by a robotic machine. Thank you very much, Mrs. Geis. Where are you? So as you can see, that he's not even on a wheelchair. Actually, on the day she was up and about on the first day of the surgery. Thank you very much. Now, on the realignment of health services in the Metro, Speaker, as part of the Western Cape Healthcare 2030, we did commit to engage the City of Cape Town to explore efficiency, effectiveness to realign city and provincial health facilities to improve health outcomes. The discussions on provincialization actually started way back after we completed the provincialization of the Rural Health Service. That was a decade ago. So last year, the City Council approved that provincial, where the province and the City of Cape Town functions alongside in the provision of comprehensive health services. Therefore, the city will let go of those health services and managed by the provinces. So the 9 joint facilities now need to be transferred to the province in this budget here, I think by June 2022. And whilst the processes related to the assets and staff are being followed, we are allocating 18.094 million this year towards the transfer. And the city has indicated that there will be another 10th one that will need to be transferred, but it has to still go via the council. So those facilities, Speaker, they are not closed. They've been functioning, they're still going to function. but it's because they were managed by the two spheres of government. Now they are being transferred to the department for that. Speaker, on innovation, because I've already spoken about the robotics. As you probably have been aware, I always brag about our technological innovations and our fourth industrial revolution readiness. In addition to e-vision, which I mentioned, and also in regard to, in addition to the robotics and others, this year I also want to brag and share a few practical innovations to show our versatility. Innovations, Speaker, are not only about devices, but also ideas. Just to make an example, one of those that I want to brag about. We have dashboards where the public can be able to access. We started with a dashboard on COVID in terms of plotting the cases and also where they are. And then using that platform, we ended up having a dashboard on the vaccination so that people can know who has been vaccinated and also who has been registered in terms of the EVDS. We use that same platform to plot now the TB, because we've got TB emergency response plan, where one could be able to plot and see the TB cases, which is also open to the public. And the other dashboard now, which you use the same platform, is the one that we are using for the violence prevention, where you can be able to plot and see what happens to the trauma cases, where are they, where are the people died, and all of those. Isn't that wonderful? It's part of the innovation, and we are the only ones who's doing that in the whole country. That is in the speak. The other part of it, the Ask a Doctor initiative, which was also part of the COVID. It was an initiative was activated when we experience vaccine apathy. The medical specialists have to go to taxi rank to the malls. They promote vaccines. People will get an opportunity to ask a qualified doctor about all the vaccine concern, which help to increase the vaccine uptake. Thank you, Premier, from your department for this initiative, because it was just actually something new in terms of from the medical fraternity, just to be outside the health facility, to be sitting in a mall and responding to the questions from the public. The Vaccine Taxi, which Dr. Tedros Ghebreyesus, the director of the WHO, has been bragging about it throughout, all over the world, was not only a well-renowned Vaccine Taxi where we transformed the EMS ambulances from not only being vehicles ferrying patients but to bring vaccinations to the taxi rank. So this is part of the innovation. No one will have thought about it. And not only about they bring vaccines, but also they bring other services under the same roof in those same taxi rank, from the family planning, TB screening, and everything else. The Grooteskier Hospital Diabetes Center is another great example of innovation at its best. At this center, we focus on complicated diabetes such as type 1 diabetes, diabetes in pregnancy, diabetes in special situations such as patients with organs transplant, cystic fibrosis, preoperative optimization of the diabetes, and this center is the first one in the country, Speaker. Olimpilo. The infrastructure, Speaker, 2019 budget speech was more infrastructure. Probably I thought it was my last budget for the health at the time that it was end of our term. It was a budget of bringing dignity to people through new infrastructure, maintenance, and refurbishments. We requested input from our statutory structures, only to realize that for the next 2 years, we'll be held ransom by COVID pandemic. But through it all, we maneuvered and made a way in a seemingly impossible solution under lockdowns. As you are aware that during the lockdowns, it was difficult for the contractors to continue with the building. But I am proud to announce these projects that actually have been completed in Winelands. Just making an example, Dudorans EMS, Evan Park will be opening Evan Park soon. I'm supposed to have opened it. Is completed under the circumstances. The Oudtshoorn Clinic in the Garden Route, the Overberg Clinic, actually in the Moravian mission stations, both of them, Ganedendale and Lim Clinic, that also complicated during this time. In the city of Cape Town, all 3 EMS units, the emergency units in the Victoria, the Red Cross, and also in Heidelberg Hospital, they were completed during this time of the COVID. In the Central Karoo, we completed Kwamandla Nkosi, we completed the Lanesburg Clinic during this time of the lockdown, and so forth and so forth. I can add as many, But as a department that is moving forward, we also have other infrastructure buildings that we plan to prioritize for the 2023 financial year. But I want to specifically, because I know that my colleague member Van Gaal is going to ask about Klapfontein, which was the hospital. I must say it. Just a reminder, Speaker, this hospital, when we decommissioned it, it was serving the whole of the community. It was about 1 million population in that area from the communities of the Klapfontein. Patients were referred by community clinics, day hospitals, and private general practitioners there. But after the Council for Scientific and Industrial Research confirmed that the old GF Juice, the hospital infrastructure, was inappropriate, and also that they recommended to be demolished. It had to be demolished. Besides that, it was offering limited service. There was no maternal and child care. There was no pediatrics there. The focus was more on the emergency, which now is being covered by the Heideveld EC. Therefore, where we are sitting as a department, this is the most crucial hospital that we have to build. I even said in the previous speech that it just has to rise. But unfortunately, it has to take more longer in regard to the capital project. But it's not about that. We're not doing anything. The tender evaluation is currently in progress to procure multidisciplinary professional services that we are anticipating now in April, May. But noting that as a department, we are we have got agencies that are doing on our behalf. For us, we are the clients of those. But as I'm saying that, I still commit this hospital is going to rise, but as we know that for such a big project, because it will take about more than 600 beds, previously it has to have 200, and we want it to be a level 2 hospital to bring all the specialization there. So it is our priority. Juster is going to rise. The Observatory Forensic Pathology Service is complete with just minor snags that are being fixed, noting that this facility must be completed before operations resume to ensure, the snags that are already there. So this commissioning of this facility is in phases. Actually, the admin component is already there. They already moved in a long time ago. But because it's a facility that will provide chemical forensic pathology, the toxicologists and all of those, the PACs that some of them that actually were undertaken by the police. So it's going to be the first of its kind. And also we want also to include the students, those who are training for the forensic pathology. So the full commissioning of this facility is expected to take place by the end of August, but everything else is complete. But you have to look in terms of the technology that will also be servicing some of these, what I've already indicated. The Bella Tygerberg Regional Hospital, Speaker, due to the size and complexity of the hospital, its redevelopment is classified as mega project. And the support is not only from the province, but also from the national stakeholders. I'm aware the National Treasury also has been engaging with the Provincial Treasury in regard to that. The process of consultation and refinement of the draft feasibility study did commence a long time ago. Further refinement and consultation are underway following a positive feedback and constructive comments received from the National Treasury. The aim of this process, which has been delayed due to the COVID-19 pandemic, is to attain stakeholder support and National Treasury approval for the most suitable approach to procure, value for money, fit for purpose, health infrastructure that is affordable. And also, why is it important for this? It's because Tygerberg Hospital, the current one, also it was assessed by the CSIR where they found that some parts of the Tygerberg needs also to be reworked. Was the whole issue about the piping and everything. Besides that, Tygerberg Hospital is the second biggest hospital in South Africa after Baragwana. And it's supposed to be a central hospital, but it also does a work of the level 1 and level 2 hospital. Just to add, Speaker, that as we know that whilst we understand that it takes longer to build new hospitals, we are not blind to the realities of population increase in other areas like Khayelitsha. Hence, we have already done the improvement. So it might not be that you are going to add extra beds and all of those or rebuild. For example, the health improvement plan, which we implemented in Khayelitsha, include where we've got the EC HECTIS, because during that time, it was not operative in terms of the information system. So that's why when we go there The system will tell you that how many people have been seen, where are they in the system, whether they're waiting for the bloods and all of those. We filled as many posts, for example, for EC consultant, which initially it was in there previously. We even increased the beds, the intermediate beds, the step-down beds, because the people might not necessarily be there, but there are additional beds as part of the intermediate care that also have been increased. Also noting that in Khayelitsha during the COVID speaker, for them, they had also the field hospital attached to it that was managed by the MSF in the Tusong Center. So it was part of the Khayelitsha establishment. So we have done quite a lot. And now what we're busy with, we are adding a psychiatry ward as part of the psychiatry units, beds that we are dealing with in most of the level 1 hospitals. So they will have, in this budget year, they will have additional beds for the psychiatry in this regard.
Minister, will you please take your seat? Raise a point of order. Honorable Said, what's the point of order?
I just want to know, Speaker, whether the Minister is willing to take a question.
Thank you, Honorable Said. Honorable Minister, you would like to take a question?
I think let me finish my budget speech, and I'll suggest the member probably just to give that comment to the next person who will be debating me from, in case that I won't be able. I think Member Van Vogel can be able to assist with that.
All right, thank you, Honorable Minister. Honorable Said, I think the message does not need any translation. It's okay. Thank you, Honorable Minister. You may proceed. Order, Honorable members.
Just in closing on the infrastructure, Speaker, the other priorities, because I love infrastructure, other priorities for 22-23, for example, in Cape Winelands, the Serious Hospital, we are adding new acute psychiatry ward, we are extending more beds for the intermediate care, and we are, at part of the Cape Winelands, we are upgrading the extension to the Park Daycare Center, a community center, and also part of the pipelines, the Robertson CDC, and then in Overberg, Phyllisdorp Clinic, it's almost getting done. Yes, the Dorrance CDC is part of it. Remember in the Dorrance, we have already opened the EMS as well. And then Central Karoo, the Northport Hospital.
Order, honorable members. Order, honorable members. Honorable Minister, please proceed.
Okay. Central Karoo, Northport Hospital, which there's been some delays in the new ward that has been there, but it is going to be ready soon. Beaufort West Hospital expansion and upgrades, which will do it in phases, starting with the EC, Matjiesfontein Satellite Clinic. In the metro, I did mention these two hospitals, big hospital in the West Coast, part of it, Swartland, Sandy Point Satellite Clinic, the Vredenberg CDC, in the Garden Route, yes, Honley Clinic is also part of it. I'm just listing, Speaker. Now, we're tabling the budget. This is the last time we get so much allocation, Speaker. In this 2022-23 financial year, we receive, what I'm tabling is 29,094,331 billion to provide quality health services to approximately 7 population in the Western Cape. I would also like, firstly, to commend the HOD and the team for the sterling work that they do, as reflected by the clinic audit findings. Speaker, I think you have to clap again, because what I wanted to say, Speaker, because it mustn't disappear. We are the only Department of Health for 3 consecutive years to have clean audit. You are the only department that I'm aware of that never stole PPE, where we use all our monies, where even the audit general didn't find, there were no findings in regard to that. So thank you, Dr. Putu and your team. In terms of the budget, Speaker, again, as we say that this will be the first time we've got bigger budget. The National Treasury has already made a recommendation in regard to the MTF, the outer years, in regard to Western Cape and Gauteng.
Order, Speaker.
Honorable Murray, you have
Thank
just
you.
broken the rule because we either indicate by a sign of raising a hand or you indicate in the chat room. I will forgive you for the last time.
My hand has been raised, sir. My hand has been raised. I want to just bring your attention to it, sir. But if you don't think I should be able to allow, I will withhold my question. But I did raise my hand, sir.
You may proceed, Honorable Murray. You are recognized.
Thank you. The minister said her department is the only department with a clean audit. Is that a reflection on the other departments in the Western Cape?
Honorable Murray,
Yes.
please take your seat, Honorable Murray. If you would like to ask a question, you ask the presiding officer and you then get the message to the speaker. If the speaker on the floor does not want to accept the question, then we are at liberty and at the discretion of the person who's speaking. Now, in this case, I would ask the minister whether she would like to take your question on your behalf. Minister?
I'm left with a few minutes, Speaker. I think after that, if time allows, I don't know what's the time. If the time allowed, I can take any questions, but you'll guide me in that. I'll just do this.
What I would like to indicate to the House is that we don't give time limit to the executive when they speak on budget.
So I can take questions.
But what we certainly...
Oh, then I'll take all the questions,
Order.
Speaker.
Order, honorable members. The speaker is still speaking. But what we always rely on is the programming authority, because you guide us on the limitations in terms of what time. I simply execute what the programming authority decides as parties guide the presiding authority. So in this case, we've got a number of budget votes before us, and our order paper has got at least 5 matters before us. It's quite a long day. So I would say to the Honorable Minister, finish your speech. When you respond later, then you can deal with those other matters, if that's the advice we need from the presiding officer. So to the Honorable Murray, that is the response. The Honorable Minister, if you're not debating, that will then be unfortunate, but she will then deal with those issues later on when she responds, if that's if time permits for that. But your point of order was not sustained because it was not a point of order, it was a point of debate. So let us proceed, Honorable Minister.
Okay. Thank you, Speaker. So the 29 billion budget, but I just want again to mention what I said earlier. The Department of Health and Wellness is the only department in the whole of South Africa that has ever received a clean audit for 3 consecutive years. Not only. Thank you, Dr. Kloete. Now, with the budget, just quickly, Speaker, we've got 8 budget programs. Program 1, which is administration, 1.4 billion, which is a decrease by the 10%. Program 2, district health services, has been allocated 11 billion. I'm just not putting the whole of the other figures, which is a 3.4 increase. Program 3, emergency medical services, has been allocated. Also 1.2 billion, which is a 4.7 increase. Program 4, Provincial Hospital, has been allocated 4 billion, which is a 4.2 increase. Program 5, Central Hospital, which is these 2 hospitals and also the Red Cross tertiary service, has been allocated 7 billion, which is a 3.7 increase. Program 6, Health Science and Training, has been allocated 397, which is a 5.8 increase. Program 7, 5 billion, which is health support services, a 1.7 decrease. Program 8, health facility management, has been allocated 1.1 billion, 84.4 increase. In conclusion, Speaker, given the budget pressures, it cannot be business as usual, especially as I indicated about what the National Health Treasury has indicated. So it's going to be the first time you are tabling such a budget. We don't know what's going to happen in the outer years. What we know that the provincial equitable share for the Western Cape for Department of Health is going to decrease. The current financial challenges we face are not the first and will not be the last. We have to be innovative and bring solutions. We have to be creative as well. It is important as well, Speaker, to communicate with our stakeholders and communities, keeping them abreast of our mission, vision, projects, and budget. Two crucial engagements that are coming up includes the health indaba resolutions, which are going to take up with the external stakeholders for their input, which is we did during the time of the NHI bill. And also when we're also talking about the UHC, that date is already been set for the 29th of April for the first engagement, but we're going to take it throughout the province as we did before. The second one is about also community participation and also amplify the people's voices, where I'll embark on a nothing about you, without you, to the people of the Western Cape in regard engaging the statutory bodies, which is the health committees, the hospital boards, the district council as community representative, especially going towards now, we're talking about the Department of Health and Wellness. Furthermore, Speaker, I want to, part of the now for the next 2 years, is to strengthen, as I indicated, Speaker, that for the wellness, road to wellness, is the Western Cape third health reform. South Africa has only had one health reform after 1994, but where we are going at is the universal health coverage. Universal health coverage, which is what now I am taking it up as part of the reform that South Africa needs. And if you just sit and wait until the national do something, we'll end up not doing it when our health system is so fragile in South Africa. So that's why, as a Western Cape, I said that I'll be champion for that. We'll make the Western Cape as a lab or as a classroom where we could be able to pilot this UHC. UHC in summary is about you leave no one behind. The issues of affordability, the equity, they make part of the UHC, especially now under the COVID conditions. Lastly, Speaker, I want to thank the private partnership for helping us during our worst moments. To name few, local government also is part of those who have been assisting us throughout, through the mayors and councillors. For the private, the companies like the CIPLA, the Gift of the Givers, Hospital Heroes, ShopRite, Oceana. I want to thank the Premier for leading, especially during the COVID, because there is nothing so frustrating when you have all the energy and also the ideas, and then it gets somewhere where we find that you cannot be able to spread the wings. Premier, listen to us as health, in as much as that sometimes we'll be so bossy about it, because we always say that we got this. Premier said, what about that? We got this. So thank you for allowing us that opportunity to showcase that we got this. And also my cabinet colleagues, where I'll remind them, saying that when they're asking about how far are we with the vaccinations, we all say that, why don't you go and find out yourselves? Thank you for the cabinet colleagues for that. Our partners for their collaboration, and most importantly, want to thank our staff that are there, Dr. Kluti, HOD, Dr. Krish Varabji. Yeah, let me just continue. It's going to take long, Dr. Karim and everyone. Also, the chairperson of the standing committee, together with the standing committee colleagues, for making us account. And we are taking some of these ideas, and we really apologize for not being able, especially me and Dr. Klutu, to come in some of those, because we have been asked, demand throughout, if you are not in the cabinet, extended cabinet, or presenting elsewhere, and also for the ad hoc committee that was developed, established through the chief whip, and also and the opposition, everyone. Thank you for being able to be there for us. And then for my staff, we don't sleep. Everyone knows that there are more than 24 hours in a day. That's how it's always been. And I always say that RIP doesn't apply to the living. So thank you very much for being there. And then lastly, to my girls, my family, thank you, Speaker. Thank you. I table the budget of the Western Cape Department of Health and Wellness.
Yeah.
Nkosi Nabang, thank you, Honorable Minister. Honorable members, I now recognize the Honorable Member Van Vogel. You You may proceed, Honorable Van Vogel. You're welcome.
Thank you, Speaker. Good morning, Speaker, honorable members, and the Mensa van die Weskaap. Speaker, I want to bring the following under the MEC's attention. Clean audit does not mean good and quality service delivery, because then Mynenburg, the Dorings and Khayelitsha would have not been still waiting. Speaker, March 2022 marked the second year of COVID-19 pandemic. Over 600,000 positive cases have been recorded in the Western Cape, resulting in over 21,000 deaths. The Western Cape public healthcare system has had to endure 2 full years of COVID-19 disruptions, including 4 waves. It has resulted in old and frail patients on chronic medications like TB and HIV and AIDS being prohibited from visiting the healthcare facilities to receive care due to downscaled healthcare services, and many infrastructure projects were delayed. As the expert continued to warn us of the possible 5th and 6th wave, we must remain concerned with the impact of further disruption to our public health care that is already overloaded with so many frailties, such as widening inequality, increased service pressures, staff and bed shortages, as well as aging infrastructures. Speaker, we have consistently warned that the department's budget, including its COVID-19 expenditure, was not focused on permanent solutions. Billions are spent annually putting Band-Aid over a gaping wound. We spend millions on hospitals of hope, vaccination centers of hope, and now there's no more hope as all these centers of hope have been closed down. Moreover, huge amounts were spent on expensive agency personnel to assist in the fight against COVID-19, when that money could rather be spent on recruiting permanent staff members. All these doctors and nurses are now getting laid off, leaving our healthcare system with large shortages. This will add to our persistent challenges, and we will bear the brunt in the imminent 5th wave. Our healthcare and economy can ill afford to have other disruptions. It is for this reason that we have to encourage people to get vaccinated. Youth cohort under 35 is the most vaccine hesitant. Speaker, Amilcar Cabral teaches us that, and I quote, hiding nothing from the masses of our people, tell no lies, expose lies whenever they are told, mask no difficulties, mistakes, failures, close quote. As a government and members of the legislature, we must find ways to engage truthfully with our youth and pursue them to get vaccinated. Let us understand the reason for their hesitancy and be transparent and truthful as possible about the vaccines and possible side effects. As we are on our path to inoculate as many young people as possible, let us physically go to them and also keep communicating with them through media campaigns. There is an allocated of 777 million for continuation of the COVID-19 response, as well as 198.474 million for the vaccination program. We hope that this 198 million will be used to open up more vaccination centers in working class communities where we exposed the shortages last year. It must not be a repeat of the stillborn idea of Western Cape vaccine procurement. Speaker, 2 years of COVID-19 disruptions have also caused unspeakable trauma and difficulties to families of departed frontline workers. During the deliberation on the department annual report in 2021, the ANC proposed the building of a wall of remembrance in honor of the departed healthcare workers. The ever-reliable, hardworking HOD, Dr. Kluti, committed to seriously consider their suggestion, yet several months later, there is no progress on this. The story of Petronella Benjamin, 62, the Western Cape first health worker to succumb to COVID-19, should be told for the number of years to come. She contracted the virus in the line of duty while fighting in the battle against the pandemic. She sadly lost the battle on April 29, 2020, a day before she could retire after after 40 years of services. What a sad day. MEC and HOD, it is saddening that 2 years since her passing, there is no hall of remembrance to celebrate her and other departed health workers. This signal that their contribution and sacrifice are undervalued. We demand that this budget make allocation for this important project. Additionally, in the Western Cape Government portal in the COVID-19 dashboard, there must be a COVID-19 memorial wall telling the stories of the frontline workers. Speaker, there are many lessons to learn from the COVID-19 pandemic. Professor Amal Amin, commenting on the lessons that leaders should take from the COVID-19 crisis, she said, I quote, "The COVID-19 pandemic is not only a global health crisis, it is also a catalyst for reimagining the way we want to live going forward. From economic systems to sustainable development, decision-making makers have an opportunity to move away from status quo and make positive changes for the benefit of humankind," close quote. This is a clear line of message. We must do away with the status quo of health disparities. There's no place for health inequalities in the post-COVID-19 society. We must do away with the healthcare system that serves the rich better while the poor are subjected to substandard healthcare service like in Khayelitsha District Hospital and so many others. We remain hurtful that this department has blatantly refused to make the available an additional 150 million for Khayelitsha District Hospital, despite the plea from the CEO hospital management and the board. The challenges at the hospital come from many years back and are close to a saturation point. Patients were sleeping on the floors in 2018 already when the NCOP conducted an oversight visit, which culminated into the Sigoka petition on Khayelitsha District Hospital. When the MEC and the department were summoned to appear before the committee, they refused, hiding behind the legal advice they received from an unnamed senior counsel. This is ridiculous and unacceptable. The Western Cape government is not immune to accountability measures. The 2018 situation of patients sleeping on the floor, staff and bed shortages remain unchanged in January 2022 when we had conducted our own oversight visit to the hospital. Rapid population growth, rising poverty levels, drugs and substance abuse, and violence crime are adding to the service pressure at the hospital. In line with the department's own criteria of allocating of funding in terms of equity and looking at the population and disease profile of people living in the drainage area of any hospital, as explained by the HOD in the standing committee meeting, supports the case for additional funding to KTH. Dr. K himself acknowledged in the meeting that the hospital has a history of social determinants, including higher percentage of trauma and violence compared to other hospital drainage areas. When we raised this as the reason for additional allocation, the MEC linked KDH to a black sheep of the family and said it will not receive special treatment. We are still shocked by our heartless comments. Premier and honorable members, we demand the additional allocation needed to improve service at Khayelitsha District Hospital. The continued decline to allocate the funds is leading to unnecessary deaths at the hospital. Honorable members, I was in Botterifield Clinic in December 2021 as invited by the clinic committee, where I learned of shocking news that the clinic had no clinical nurse practitioner. As a result, the cleaner had to assume the responsibility of a nurse. This is not an isolated case. There are many similar stories of chronic staff shortages in health facilities in poor working class communities, like it is the case with KDH. The clinic committee request for department intervention fell on deaf ears. I asked myself, is this the idea of the universal health coverage that the DA supports? Honorable Philander, is this what you mean when you reject the NHI in favor of universal health coverage. In response to this call of Prof. Amal Amin, alluded to above, the national government is moving away from the status quo and is making positive changes on health for the benefit of the people. It has introduced the national health insurance grant and allocated 43.6 million.
Will you please take your seat? There seems to be a point of order. I'm gonna just pause the time. Just help me, table staff, as you usually do. What's your point of order, Honorable Bossman?
Good morning, Honourable Speaker. Honourable Speaker, as the Deputy Chief Whip of the Opposition always reminds us, the Honourable Member needs to address Honourable Philander through you and not directly, Speaker.
Thank you, Honorable Bossman. I must say I picked that up, Honorable Van Vogel, but I wanted to know whether the whipper is still on duty. Now I realize that all other members are awake and they are guarding you. So please address the presiding officer, Madam. You may proceed.
So. Thank you, Speaker. We'll do so. Speaker, it has introduced the National Health Insurance Grant and allocated 43.6 million to the province in this budget. It includes NHI, HP contracting component allocated 18.2 million and a mental health service component with 25.4 million. The dream of the NHI will soon become a reality. Whether the DA likes it or not, we will do away with the status quo and put in place a system that provides equitable access to quality health services for all, despite one's social standing or financial status. Speaker, in furtherance to this, the Finance Minister announced in his budget that over the MTEF an additional 15.6 million will be distributed to provinces to fund COVID-19 responses and to reduce the effect of budget reductions on essential medical goods and services. Moreover, 3.3 billion is allocated to absorb medical interns and community service doctors. As a result, the budget for the department increased by over 1.7 billion from 27.4 billion in 2021-2022, main appropriation to 29 billion on this budget. We welcome the increase and we are grateful to the national government. Our biggest concern, though, is this department over-reliance on the expensive agency personnel. We remain vehemently opposed to the department overuse of agency personnel. Speaker, while we welcome the 8.39% increase on the budget for health facility management to a total over 1.1 billion, we are alarmed by the cuts on maintenance and repair projects. The province has a serious challenge of aging and dilapidated infrastructure. In hospitals like Groote Skiertydburg and various other hospitals in the rural outskirts. The cuts to this budget are not acceptable. We remain alarmed by the snail pace of the rebuilding process of JF Jooste Hospital. Not a cent has been spent on the project to date. The people of Mynenburg will have to wait until December 2032 to get their hospital. To add salt to the wound, the integration health service in the city will lead to a closure of 9 clinics in Mitchells Plain, Nyanga and Kailicha. We reiterate our stand that no clinic must be closed, as this will further jeopardize public healthcare service. The MEC says no clinic will be closed when MACO member has clearly said there is consideration to permanently shut down some clinics. Speaker, in conclusion, the ANC views the community healthcare workers as an integral part of the healthcare service delivery. We know that not much focus is given to them in this budget. We continue to be on the side of the workers who demand a monthly stipend of 3,500. We are aware of growing calls from various stakeholders, including unions for the department, to insource security service. The MEC must tell us why our department is rejecting these schools. The ANC has already expressed its view to not support this budget as motivated by the strong conviction that the proposed budget is anti-poor. It does not provide sustainable solution for post-COVID-19 recovery. It has failed to address the chronic staff shortages, widening inequality, infrastructure challenges, and service delivery backlogs. We do not believe the department is living up to its mission to provide equitable access to quality health service to the people of the Western Cape. I thank you, Speaker.
Thank you, Honorable Van Fochen. You were within your time. Thank you very much for that. Honorable members, I now recognize Honorable Pego Ngonde.
Thank you, Somlom. The EFF in the Western Cape is disappointed to learn about the proposed provincialization of the City of Cape Town's primary health care services. This is a move that we all know that the absorption of these health facilities would mean a closure of some of them. The likes of the Durbanville Clinic, Goodwood Clinic, Kailicha Clinics, Nyanga, Paru, and Kraaifontein, to mention a few. This latest downward spiral collaboration between the Provincial Health Department and the City of Cape Town is unprecedented when one takes into account that they previously closed down 63 health facilities since 2014. This is a very shocking consideration. The fact that the department itself acknowledged that the Western Cape population grows by 2% per annum, meaning that there should be the scaling up of the health facilities and the resources in the province, and not closure of facilities. It is not acceptable for the minister to say patients in hospitals such as Kailicha will continue to sleep on the floor, as she earlier mentioned, and cannot be accommodated. The billions of rands spent on infrastructure were also supposed to be redirected to converting the clinics they intended to close to hospitals that will accommodate our people, and to also consider the piloted project that she initiated in Grabo of a 24/7 facility to ensure that our people have got access to healthcare. That DA-led provincial government should always come up with solutions where there are challenges and concerning our service delivery. This is the same government that will always tell our people about private-public collaboration when it comes to business development and issues concerning unemployment. But then the question is, why is the very same government not engaging into public-private collaboration in finding resources for our people and making sure the health facilities do not close their door? The challenge we are facing in this department, and it does not look like they are in a position to address them. In Ceres, communities are up in arms as the elderly and the disabled, together with the children, are forced to queue for hours outside the health facilities. It is in this regard that we request that this department should consider opening clinics 24 hours so that our people would have access to healthcare. As the EFF, we are not going to promote a budget that does not help our people. And we therefore do not support this vote, as it still talks to the privatization of health services, because our people would now be forced to go to private facilities. Thanks very much, Somlo.
You're welcome. Thank you, Honorable Payego. Honorable members, the next speaker is Honorable August.
Honorable Speaker, the Western Cape government boasts that it has the most functional and reactionary health services in the country. This would have been a breakthrough for the many in poor and rural areas who are struggling to access basic health services. Just last week, we have seen the Ceres Health District in the spotlight as residents of Witzenberg municipality have been complaining for 10 years of medicine shortages, overworked staff, shortages of bed and medical infrastructure that's falling apart. The City of Cape Town has without shame ventured to close down or trying to close down 2 clinics in Mitchells Plain amidst cries for the community to halt this action. So, Speaker, when we speak about the best health services, what are we referring to? I personally know of clinics and community daycare centers that patients despise going to. Why? Because of how they are treated, the type of care that is provided, and the services that this government feels our people deserves. The health budget is an important one of any government. It directly impacts community development, mortality, and the future of our nation. Today, I'm calling on MEC Noma French Bombo to wake up from a slumber and understand that there exists a real need for proper, functional health services that residents can proudly access without fear of intimidation, prejudice, or safety challenges. You have a responsibility to do better. This government has the responsibility to do better. So do not allow your service delivery mandate to be influenced by your need for self-praise. Do the right thing and serve. We can have clean audits, but the people of this Western Cape is still suffering.
Thank you, Honorable August. I presume you have concluded your speech. Honorable members, I now recognize the Honorable Member Mare Akhbare.
Thank you, Speaker. Speaker, in my 2 minutes, I want to try and get as much in as I can. But I want you to know it's 2 minutes. Okay, don't expect such a good presentation. I cannot support this budget, although I supported the main budget, because we've been presented a different picture by the Children's Institute of Cape Town on the 1st March 22 about what happens in the health department. We hear about the whole society approach, which the minister mentioned, but the minister didn't tell you that children beds, pediatric beds are now being used for COVID patients. So the children are being neglected. She didn't tell us that in the first year of COVID, we only had 284,000 cases of COVID, of which 12,300 were children, and 59 died in the first wave. 4 years later, the 284,000 cases became 658,000 cases, with 46,455 being children under the age of 18. And 3,924 had to be hospitalized. She didn't tell us these figures. She didn't tell us how this, the whole society approach have improved on this. Is there a focus on children? I believe that children under 12, we were told, were put in single rooms at the hospitals with no supervision. I also said that mothers and babies who had COVID were kept together. Now, I don't know how you cannot come and say I have a clean budget. Doesn't mean you have a very good record of looking after the health of our people. We're going to look at that. I want to know how many. Oh, 2 minutes is over. Saved by the gong, Minister, saved by the gong. Thank you, Speaker.
I even gave you a few seconds more.
It's all right, Speaker, it's fine.
Thank you, Manier. Honorable members, I now recognize Honorable Brenkes.
Thank you, Speaker. Speaker, I'm not speaking on this vote. Thank you.
Thank you, Honorable Brenkes. If you had negotiated with Honorable Murray, you could have borrowed him.
That is in order, Speaker. He can continue.
Next time. Honorable members, I now recognize the Chief Whip of the Majority Party, Honorable Wenger.
Good morning, Mr. Speaker. Good morning, members. The Western Cape Health Department has a lot to be proud of. It is the only health department in South Africa that lives by the values of innovation, care, competence, accountability, integrity, responsiveness, and respect for all the citizens which they serve. We welcome the Minister's announcements in the House today. So many exciting and impactful announcements. Congratulations to the Department of Health and Wellness. This is so much more than just a name change. It speaks to the strategic focus and direction of this department. If health is the goal and wellness is the active process of achieving it, we cannot have health without wellness. We can't have one without the other. This is a truly forward-looking and holistic approach to ensure that you, the citizen, can live a happy, healthy, and fulfilled life. Well done, Minister, and well done, Department of Health and Wellness. We welcome the Violence Prevention Unit established in this department. Public health can indeed make a valuable contribution to violence prevention and cover a much broader spectrum than the criminal justice system alone. This is the whole of society in action. We are so pleased that the Western Cape is following global best practice. Internationally, violence is a focus of the work of the World Health Organization, and there are moves in developed countries for health departments to be involved in violence prevention. Again, the Western Cape is leading the way in South Africa. Honourable Speaker, as South Africans and residents of the Western Cape, we've been through some very difficult times. The reality of COVID-19 has taught us many lessons, and one in particular stands out. And for me, that is interconnectedness. We saw how a government, civil society, and private partners ensured that during this pandemic, instead of being pulled apart, common purpose of human dignity and well-being were at the top of the agenda. We saw how the determination and resilience of healthcare workers instilled hope in all of us. Speaker, a people-centered government department makes sound policy decisions in order to enhance the health of society for all residents in this province. Over the 2022 MTEF period, the departmental focus will shift from recovering from the pandemic and implementing 6 strategies of action: service redesign, governance redesign, health public policy, recovery strategies, surveillance, and an agile health platform and vaccinations. This is not only a health system for you, but for all of us, and a health system that will push us forward. Speaker, this department has all the hallmarks and is clear on addressing the needs of residents and has a strategically clear policy directive that makes its vision a reality. Healthcare 2030 is intended to enhance the health system's responsiveness to people's needs and expectations, with careful consideration given to person-centeredness, integrated care provisioning, continuity of care, and the life course approach, all of which will ultimately lead to the obtaining of universal health coverage. Speaker, the Western Cape Health Department will continue to push forward with the Resurgence, Recovery and Reset strategy. This plan describes how the department intends to build and push forward as the health system recovers from the various waves of the pandemic and manages the risk of resurgence in the next few months. The pandemic has provided an opportunity for renewal and a reset of the department's agenda as we embed the lessons that we have learned. Health is everybody's business, and a framework of action has been created over the MTEF, which aims to present the Western Cape Health Department's long-term aspirations for provincial health system, as well as map a course of action to ensure sustainable recovery from the pandemic. As we take steps to manage the waves of COVID-19 and recover, we must be mindful of the fact that social and economic effects of the pandemic will influence the decisions we make today in order to shape the future. For this reason, we welcome the 29 billion rand budget, an increase of 900 million rand, or 3.2% from the revised estimates of last year. This budget speaks to a wide range of opportunities. 114 million has been reprioritized within the departmental baseline to fund projects linked to addressing surgery backlogs, mental health platform strengthening, addressing tech refresh backlogs, strengthening occupational health and capacity, central warehousing of non-pharmaceutical stock, obstetrics and neonatal improvements, as well as establishing capacity and capability for providing palliative care services. After centralizing the procurement of PPE in 2020, it has resulted in a complete warehouse being set up with PPE valued at 80 million rand in total. This year, a significant focus is being placed on infrastructure. And here, Honourable Windvogel would do well to pay attention. Spending on existing infrastructure assets increases by just under 11%, with upgrades and additions and refurbishment and rehabilitation spending increasing by 99% and 54% respectively. Moreover, new infrastructure spending is 110% more in comparison to last year. 110% increase since last year. Now, this is a department that ensures quality healthcare for you, our citizens. Infrastructure projects for this year in total equate to 107 in planning, design, tender or construction phase. In the Western Cape, it is clear that we are committed to serving our residents effectively and safely. Our communities can look forward to the following examples of good governance in action. New Avian Park Clinic, upgrades and additions to the Hansby Clinic, a replacement clinic for residents of Gouda and surrounds, a replacement clinic for Ladysmith, pharmacy, compliance and general maintenance to Nyanga CDC, replacement clinic for Sandy Point Satellite Clinic, a replacement clinic for Villersdorp, a BMS upgrade for Groote Schuur, and 11 kilovolt generator replacements at Tygerberg Hospital. By contrast, Speaker, the Gauteng Provincial Government spent 1.2 billion rand on COVID-19 ICU hospitals, which, as the Daily Maverick reported this week, are laying waste. They are weed-riddled, abandoned and unfinished, where no citizen can receive healthcare services. Is that what Honourable Windvogel rather wants? 4 out of the 5 of these Gauteng hospitals were the sites for the controversial alternative building technology field intensive care units, which were commissioned in March 2020 and which are currently the subject of SIU investigations. Let's compare this to the Western Cape Hospitals of Hope, world-class field hospitals with digital patient records, Wi-Fi for patients and good quality care. This field hospital was later converted into a world-class mass vaccination centre. No ruined, dilapidated, derelict buildings in the Western Cape, Speaker. This is rather an agile health department that cares for you, for the citizen, by delivering quality services. The ANC's answer to the same question was spending 1.2 billion rand on buildings that were never completed and never treated any patients. Speaker, as South Africans and residents of the Western Cape, we now know why the state of disaster was not brought to an end. Because it means that corrupt persons in positions of authority could continue with procurement on an emergency basis without compliance of any of the normal prescripts regulating public sector procurement. The Western Cape, by contrast, is the only province to have regularly published COVID-19 procurement reports for the province and its entities. This is a continued commitment by the DA-run Western Cape government to good governance and transparency in public procurement. Honourable Speaker, while some in the national government were bulging and had blink backgevreed, many South Africans did not know where their next meal would come from. While South Africans were struggling under the draconian state of disaster regulations, ANC cadres were unduly benefiting through unlawful and illegal activities and procurement processes, as well as their friends and family members. The 500 billion rand relief fund announced by President Cyril Ramaphosa back in April 2020, which was intended to combat the spread of COVID-19 and offset dire economic losses resulting from lockdown, is now being investigated following cries of corruption. SIU spokesperson Kaiser Kanyago confirmed that all allegations of corruption relating to the 500 billion rand relief fund would be consolidated into one investigation within the national COVID-19 proclamation. The president, who initially certified the relief fund, which accounts for 10% of the country's GDP and relies on backing from international financial institutions, will need to sign the proclamation before the SIU can begin its investigative work. And as we all know, former Health Minister Zweli Mkhize has also been implicated in corruption. He resigned last year after being linked to an irregular tender, 150 million rand, Digital Vibes communications tender. And it was revealed that Digital Vibes allegedly paid renovation costs to another townhouse owned by Mkhize's trust. The tender was apparently awarded to his close associates and apparently benefited his children, who grotesquely flaunted their pet lamb, which he dressed in Louis Vuitton clothing and paraded on social media, while patients in hospital didn't even have any food. Now, according to media reports, Mkhize is apparently linked to corruption involving the UIF as well. Once again, this week, the ANC has shown to be rotten to the core, even outside of the parameters of the state. 346 staff members were scammed and robbed by their own employer. Luthuli House has not paid over employee tax, UIF, or skills development levy, even though it was deducted from staff members. It is evident that with the ANC around, you have to have eyes in the front, in the back, and on the side of your head, because they don't only steal from communities, they even steal from their own staff. It is unconscionable, Honourable Speaker. In the Western Cape, we live a different reality. Our doctors and nurses do not have to bring food to our patients in hospitals, as seen in some other provinces. The Chris Hani Baragwanath Academic Hospital ran out of food 2 weeks ago. Things got so bad that nurses had to use their own money to buy bread for patients for breakfast. For lunch, patients had food purchased from street vendors. Speaking to News 24, one of the doctors said that it was a humanitarian crisis. This signals a complete moral decay and a compromise of national integrity, where sick and vulnerable patients cannot be provided with basic healthcare and nutrition. The contrast between the delivery of services to citizens in the Western Cape and other provinces is stark. I also wanted to respond to Honourable Windvogel and Honourable Plejo on the clinics. And just for noting, Speaker, through you to Honourable Plejo, it's not privatisation of clinics, but provincialisation of clinics. As part of the Western Cape Healthcare 2030, the Western Cape made a commitment to engage the City of Cape Town to explore on efficiency, effectiveness, and to realign city and provincial health facilities to improve health outcomes. The discussions on provincialisation started a long time ago, many years ago, after the Health Department completed the provincialisation of rural health services 2 decades ago. Last year, the City Council approved that provincial, where the provision of health services by the City of Cape Town functions alongside the provision of comprehensive healthcare services with the Western Cape Department, the city will let go of those to be managed by the province. There are 9 joint facilities that will be transferred to the province in this budget year. So I think it's important for us to clarify that. Speaker, finally and in conclusion, the DA unequivocally supports Vote 6. It is a budget that will push healthcare services in the Western Cape forward to be even better for you, the citizens of this province. Thank you.
Thank you, Honourable the Chief Whip of the Majority Party. Honourable members, I now recognize the Honourable Minister.
Yeah. Thank you. Through you, Speaker, thank you. The input from the colleagues. Starting with Member Windvogel, I do understand that when we write speeches, you write them beforehand, and then sometimes it could be difficult to make changes in terms of when the new information comes up, because some of what she's responding to is already what I've already tabled. Probably maybe it was for her just to scratch and maybe comments around some of those. But having said that, but thank you for the input. I don't want to go through in terms of what also she indicated, because it is part of the speech And also, Speaker, they will distribute a summary of this. And also, I think the speech is already sent to your office in regard to for the dissemination. But Speaker, I just also want to make use of this opportunity also to explain further, because when I deliver the speech, you just make an assumption in some of the things. So sometimes it's better just to probably to give effect in regard to that. Now, starting with the issue about the clean audits. It's not the Western Cape government who came up with the Auditor General and also about in terms of how the governments in South Africa needs to be run. So when we started post apartheid, and then we ended up having a constitution. If you look at the chapter 13 of the constitution, it talks about the finance on how these governments should run. If you look in terms of the role of the AG, in terms of the chapter 9 institution, this is what is it? It's not what we was talking about DA. We are not in national government yet, in as much as that we make contributions in some of these, for example, in the as part of the constitution. So, and secondly, the issue about we must understand that clean audits, it's not only, I think the member clerk also alluded to that. We are very much aware that financing generally, without even looking in terms of the auditing, health financing is a system on its own. Health system is made up of systems. And one of the systems is health financing. And then the other system is a human resource, which she mentioned about agent and all of those. If I could talk about each and every system that makes up, that builds a health system, Speaker, it will take long. So health financing system, human resource system, leadership and governance is a system, health information is a system, research and access to availability of medicine is a system, and then a service, which is what type of a package of a service you bring is influenced by the other systems, like in the HR, if you need specialists to do renal care and so forth, and all of those things. And then we normally add another system when we say people system, because the people should form integral part of it. So we cannot be just bragging about clean audits out of context. It's part of building a health finance system that feeds to the whole overall system in order to see what packages of care you deliver. So the bragging is about, because they take, you don't understand the amount of work that they have to undertake. Things that need to be in place, the checks and balances, and then having smaller units out there in terms of looking at this part of this, which is too much compliance. It is this national government that came up where now the officials have to spend so much time in compliance in terms, because it's how it was made that it is the crucial about it. So it's part of it. And here, Speaker, when I got orientation as a member of legislature on the first days when we started in 2014, we were given a lot of books, smallanyana books, which is, I'm not sure they say, I always carry with. One of it talks about the accountability and the financing and all of those. It talks about this. So that's why we come and appear in the scopers, in the committees and account in terms of how do we do with the monies. That's how things are. So it's not about to break out of context. So just to keep it, to make sure that you understand that it's not out of context when we talk about the clean audits on unqualified or qualified and all of those. It's part of the system that was formulated nationally, and then that's where each and every government has to do that. Now, now on NHI, I think also, because I think she was talking about, thank you, ANC, government for the NHI, and the NHI you don't want. Let me just give you a background about the NHI. Firstly, National Health Insurance It is an insurance. It's just like outsurance. It's like ANG. It's an insurance. It is an insurance. It is an insurance. It talks about the insurance in terms of the part that feeds to the health financing as part of the building blocks. Now,
Order, Honorable Member.
what we are saying,
Please proceed, Honorable
yes,
Minister.
what we are saying is about that. Indeed, financing of a health system is part of what needs to happen. That's how you deal with it, because it's part of what needs to happen. But doing that, the end goal must be a health reform where it leaves no one behind, which is the universal health coverage. Health coverage rests in some of the pillars on equity, which is it cannot be the people of the Mossflay, the people of Maritzburg, they only see a mobile clinic once a week. Just making an example, the issue of the equity compared to the metro. That's how it cannot be able to leave people behind. Issue of the affordability, it cannot be that then I need a renal dialysis just because I cannot afford. I cannot have it because there are no monies I have to pay. It's part of all of those things, and also about the quality of care. So when NHI was introduced, it was supposed to be in 3 phases. In as much as that when loosely they will say it's part of UHC, it's not, because it only talks about one side, of which is insurance funding, and NHI is also supposed to form part of the UHC. NHI as a form of financing, it is done in other in other countries, in other few countries as a form. There are different kinds of financing, like UK, they use Bismarck, NHI, I think is also part of New Zealand and all of those. It's an insurance, it's insurance. So when they started it was going to be in 3 phases. The first phase was 2012 to 2017. That phase 1 was about strengthening the health system to the primary healthcare system. And it was about piloting that. Then they started with the 11th district, and then they added, I think KZN and West Eastern Cape added more. And now what was happening around, and then for us in the Western Cape, they identify Eden, which is Garden Route, as part of it. Part of it, it was about ward-based community health workers, about the school health, it was about the infrastructure, and so forth. Now, if phase 1 ended in 2017, yet you have, for example, the PACS, the Pakastop Clinic, they identify that is part of NHI. How come that Pakastop Clinic is still not built, yet it was part of that? I can name as many, the Pakdins and whatever, because even with the Rust Clinic in Oudtshoorn, they only did it now, later, because they manage it themselves. And then they want to appoint the contractors themselves, like in the case of the PACS. So a first phase that was supposed to have been completed in 2017, you find that dololo. And then now we have to pick up the pieces. Because we have to be also, how do I go to Pakastop and explain to them that that extension that were promised by the national, and now even actually that 14 million for it, it keeps on decreasing. We are appointing professional service, we are doing this, and it's managed by them. The issue of the appointing GPs as part of NHI, they said that, no, we're going to do it ourselves. We've got a company where we'll just appoint whoever there, Dr. So-and-so, there in that district, and then we'll come. That's when Western Cape said that no ways, because you are strengthening the health system. Now, you cannot just, and then appoint, give us the money, we'll do it ourselves. And we did it ourselves. But now this thing about we've got extra money, this was supposed to have been done long ago to bring these GPs in the rural areas. Because now they end up not using the money, they just hoy. Yet they're supposed to have established that. Now with the phase 2 of NHI, which is supposed to 2017 to 2022, first phase was about now legislation. Look what actually 2022, they're supposed to have even completed the amendments of the legislation. In addition to that, which is the NHI bill that we're talking about, is according to their process, long overdue. And they're supposed to repeal 12 acts out of those that include medical schemes. Where are we in repealing those acts? Because even if that bill gets passed in Parliament, nothing will happen without repealing those 12 acts and replace them with the others. Dololo, nothing. The third phase of the NHI is now about the taxes. Yes, the taxes now in regard to where they're going to get the money. Already we made inputs in terms of where they could be able to do the issues of the taxes and everywhere, but it will never happen until they fix the repealing of the bills, so that also private hospitals that were long due, overdue to be regulated, it never happened. That is the NHI we're talking about, which is supposedly to be the first ANC health reform. They never had any reform since 2000, since then. And also community health workers, they're also part of the NHI. Now, let me just now talk about, because I also mentioned about community health workers. It's part of the ward base, which was part of the phase 1 of the NHI. Do you know that even up to now, they don't know where to place them because they're supposed to be part of the health system. It went to the bargaining council where they talk about the, I think it was resolution 1, about the salaries and whatever. And now they're taking back to the Department of Labor because nobody knows how to deal with it. That's the issue. And then for us, they'll say, go when I'm going to pay whatever. They must fix it there because it is their own thing and we cannot be able to do as much as we can. However, as we always do, we don't fold our arms and waiting for them to wake up whilst they are snoring. What we do, we make it a point that's why we're going to have a health summit, which is we did it actually in 2016 in terms of the home and community-based services, which we're going to do it again to have a conversation with the NPOs, with the civil society and community health workers as part of that. Yes, so I just wanted to be clear in regard to the NHI. And then lastly, on Member Van Vogel, I spoke, there's a reason we added awareness. I spoke about the upstream factors. And he's talking about, you said Caritas is not a black sheep or whatever. Health absorbs everything. Every social ill, socio-economic-political ill get absorbed by health. All the inequalities that are generated outside the health system, we have to absorb them and then we're expected to fix it. I always making an example. If in the school that they are full when it comes to enrollment, and then they'll say, go to find another school. Nobody worries much in regard to what's going to happen to Usizwe for not getting the school. And 2 o'clock, everyone goes home. Schools closed, their learners are with their parents. And if it's about their housing, if you are number 450 in the housing list, irrespective that you might be sitting, staying in Kukwin and whatever, it's not much that the Department of Housing will have sleepless nights in regard to that. Someone has to fix that issue that we are not having a housing and so forth. But when it comes to health, when Khayelitsha has got 300 beds and it's full, I still have to take a responsibility for those ones that where we cannot say, I'm closing that gate now, Khayelitsha is full. You can't. In any health system, not only that we don't close, it means that it's a whole cycle, 24 hours, 7 days a week, 365 days. Nobody gets any of a break. We even have to be worried about even those patients who are in the private. When they are charging higher prices, or also when the health outcomes are bad for the province, it does reflect on us. If there's a likelihood that there's a high infection or whatever that is happening in the private, it's our responsibility. We are responsible for the health of those learners whilst in the school, they are under other sectors. We are responsible for the homeless whilst they are under social development, wherever. That's what we do. Now, that's why I was saying that with the upstream factors, like the case of Khayelitsha, that the issue of the trauma in regard to, especially over the weekends, that come in where people have been shot, have been beaten and whatever, it does have huge impact. So the issue about that is about how to address the socio-economic factors in that regard, because that's the main thing about it. But how can we work together in regard to that? So that's why we step up when the Premier challenged us, take over terms of violence prevention unit. We submitted, we made a presentation, even when there was a multi-stakeholders in Khayelitsha after those multi-killings that happened there. We say that, unfortunately, some of the people who get beaten here, you go directly to the hospital and then they give you treatment. But in some cases, you won't go to the police station to report. So that's why it becomes skewed, because police, they won't have this information. But But for us, we already have the information that that's what has happened. So until it's a whole of society, in whole of government, and everyone make sure that the socio-economic factors. So that's why we participate in the whole of government in regard to the jobs, because for us, we want to see where do we appoint, have high level of employment, because we know that economy and health, they are like this. When the economy is down, it means you have most of the social ills. Similar, if you have got sick people, it means that it will have an impact on the production. Hence, we are also participating in the spaces of the dignity and all of those that being led by the and well-being by the social development, because we have got a footprint everywhere and we have to absorb all of those things. So, Member Van Vogel, Khayelitsha situation, we can pump and add as 500 beds, but it's not ideal to institutionalize people. Don't focus much on the bed for the sleep, but you have to close the tap elsewhere, so that you don't end up having all these social ills that are happening there. You cannot have a situation where we have got a high level number of...
Honorable Minister, will you please take your seat? Honorable Van Vogel.
Ask the MEC to speak through you, Speaker, please.
Thank you, Honorable Van Vogel. I just want to say, Honorable Van Vogel, let us not break the rule to correct another breaking of the rule, because we have to lift our hand in order to address the presiding officer, and that is not occurred in this case. So please just follow that rule. It makes it easier. Honorable Minister, will you please address the chair as you continue to speak?
Thank you, Chair. I thought it's exactly what I was doing. That was fine. Thanks. Now, let me skip the others. In terms of the vaccination centers, let me skip the vaccination centers as if it was a waste. Do you know that we are the only, because I didn't want to mention, because I've mentioned previous speeches, we're the only province that built an 800+ hospital within 1 month. So China built it theirs, field hospital, within a week. We built it within 1 month. We're the only hospital that has done that. And also, without even wanting to waste, when it was about now that we are out of the wave, and also at least we've got our ducks in the row, because as you know that, Speaker, is that we kept on learning, because there's no way with this COVID pandemic you could be able to transplant some of the lessons elsewhere. You have to use the local data and be informed about this. So we have done it before. Similar thing, when we have to say athlon, we need a drive-through in terms of the vaccination. It's part of it. You cannot say that it was a waste of money. But now there's no need, because we are going towards the integration of the COVID vaccines and everything together with other services. So that's why we even had a pilot, testing, where you'll go to a taxi rank through the Vaxi taxi. There in that gazebo, it's someone who's screening for BP, for HIV. There it's the one who's doing the vaccines and all of those, and which is happening at the facilities. So we cannot say that it was a waste of money for us to build those. But Speaker, I did indicate that we are ready for the 5th wave, because I didn't have to repeat that, because we still have got the field hospitals that are attached, like the Sonstral for the Weskus and for the Cape Wildlands, the Hericome for the Garden Route. We've got the Mitchell's Plain also in terms of the field hospital, and also additional hospitals like additional that has been happening in Stellenbosch Hospital, in Vredendal Hospital, elsewhere. We already have the issue of the staff everywhere. When there's even any province or even internationally, we did a contract staff during the time that we have got the highest pandemic and so forth. So the contract has to end, the contract. The question is about now, why are you not employing them? We have seen in the Eastern Cape, they went even to the national about it. But it's the nature of the game. You'll have permanent staff, you'll have contract staff. And if you're going to have maybe another pandemic that is elsewhere, you'll appoint staff, but on contract basis. But we always mix. It's not about agent staff and only as well. Now, remember, Clarko, I did mention that we're not closing those 9. It's not the first time, actually, where you will have both local government and provincial government under one roof. The issue is about someone has to absorb the overhead costs and so forth. Just to make an example, probably you're familiar with Nolungi, Site C, where we are both there. So it's about, it cannot be where when you are going to child health is done by the city. So you go that side, you turn right to go to the child health. And then once you are waiting there, and then you find that you are ill, and then you are done with a child, and then when you are ill as an adult, now they'll say go to that provincial site, which is under the same roof. And then when you go there, you start another queue. So why can't they do all under one roof? So when I'm saying I'm sick, the same person is looking after me, is looking after the child, instead of going another queue. That is what we are trying to do, is about, let's do it once. The question is, why can't we do it? It's because each and every sphere has got responsibilities in regard of what type of a package that they need to provide. And where we are now is about people need the whole package of comprehensive care as according to the provisions of the ideal clinic. So the Durbanville, they are not being closed. The Scottsdene, they are not being closed. The Turkey Ace, they're not being closed. We have done it before. We have Bothasach, you can see that's what we have done. So it's part of where actually the patients won't even feel that there's a difference, because they didn't know that actually there's a sister in charge from the city, there's a sister in charge from the province under the one roof. Nobody knows the difference. That's what we are doing. So NB, here in the province, there are no facilities that are being closed in these 9. If the city is closing any of their clinics, Mitchell's Plain or whatever, we don't know anything about it. It's not our Nansika, because it's there, there's fear of government, they've got ownership of those, we don't know. So it's up to them to make kind of those announcements. Member August, the other thing, because I did, it's a budget speech, you don't want to bring everything. The other services that you are bringing back, the renal care, which is already, especially like in the areas like Saldana, for example, where we make sure that people don't have to go all the way going to the Grooteskill and all of those. So we are opening up many of the services, maternal and child health. Recently, I was in the Central Karoo, where we have seen how they're assisting for high-risk women and babies that are coming not only from the Laingsburg, even from the Maritzburg side. So there are many of those that were open up. Thanks, Member Murray and Member Brencase, for your silence means consent, Member Brencase. Chief Whip, thank you for all the inputs that you have made. Actually, you have responded to many of those that also have been alluded to, and also just also because I think the main part that I was excited about is about when you reflected again on the infrastructure, because here earlier it was about when are you going to build this, where you mentioned, which is I did mention in terms of e.g. in the garden route, these are the kind of services we will be focusing on this year and all of those. What we do, we have got the manual of the health infrastructure. Actually, even in the APP, at the back of it, you will see that each and every infrastructure at the different stages, as according to the delivery phases, where it will say concept, ending when, we'll say that it's replacement, new, or it is where refurbishment, starting from when, the project ending when, and then in most instances, I will ask the team that, can you please fast track this one? But it means that you have to rob Paul and pay Pauline in that case, especially in the cases where you'll find that there's a high level of the pressures in a particular clinic. For example, the Honeycoots here, where we find that the team, it was about prioritizing Diazaville. I said, no, start with the Honeycoots here and then you do the Diazaville later, because they ban the clinic anyway. But these ones, at least Honeycoots here, as you can see the environment, how it is. So that's what we do, Speaker. And then, Speaker, I think I've responded to all the questions. Thank you for the members for those. But lastly, again, I want to acknowledge properly the staff, because I wasn't aware that there are others on virtual. Again, Dr. I call them KV, Dr. Valabji, Chief Director for Support Services. It might be his last time. Now he'll be presenting, has been with us for 41 years. If I put it all together. He was a CEO of Victoria, can't remember, but he has been with us. So it might be his last time. Of course, you know, Dr. Klute, not only the HOD of COVID is the HOD of everything, of clean audits, is an HOD of wellness, is also in our HOD of universal health coverage. Dr. Klute is KC, KV, KC. And then we have got Dr. Sadiq Karim, so KS, who's the DDG and COO. Sadiq Karim, we don't do politics in health. Who's as I indicated, has been, you know, some of you know, he used to be the CEO, medical soup for Grooteskill. Chief Vahabiki. Chief, the chief director for finance, I might not put clearly in terms of exactly, but in financial management, UCC Uandangosi. And then I think on somewhere we have Mr. K, who's our DDG for corporate service, stroke the money man. There is, just to check. Yes, and then the supply chain chief director, Pumamo Isaacs for supply chain, and also with her team, director for supply chain management, Ronald House. We've got director for health impact assessment, the dashboard man, Dr. Melvin Moodley is also there. The director is doing everything, but I always say that the director who deals with the appointment of clinic committees, statutory bodies, Undoda Mavela, and also the licensing of the private hospitals is also there. Karin Ching, who's the director for strategic planning, is also there. Makonza, who's the director for information and technology, I think is there as well. And then the last person, which is I can see whilst I'm here, Chief Director for People's Management, Mama Benedict. So these are the people who make us look so good. Thank you very much, the team. Thank you.
Thank you, Honorable Minister. Order, honorable members. Honorable, the leader of the opposition, is that a point of order?
Yes. Thank you, Speaker. Just a point of order. As far as we're aware, Speaker, Honorable Philander is the chair of the Health Committee, the Portfolio Committee. Could you explain why she did not speak today and the Chief Whip instead took her place?
Thank you, Honorable, the leader of the opposition. Just before the response is given to this, order, honorable members, I want to release everybody health, unless you want to say, because I need the box for the premier. Thank you very much, and to the retiring gentlemen, thank you very much. May God be with you. The Deputy Chief Whip of the Majority Party.
Speaker, Member Philander, due to family reasons, are not able to join us here today, and someone is standing in for, and it's becoming actually quite annoying when members of the opposition are trying to pry into the information of people's private lives. And it's been happening like week after week after week. If they want to know about someone's private life, they can either go and ask the person themselves or through you, Speaker, ask for the information. But it's becoming very annoying now that people are prying into other people's private lives and they don't even regard the POPI Act in this regard. Thank you.
Thank you, Honorable the Deputy Chief Whip. I think for the House, it suffices to say what is the basis of her absence. I think anything beyond that, it's not for the House to deal with. May I then stop any more discussion on this matter? Otherwise, it will just turn into something else. I'm going to request a 5 minutes comfort break, Honorable Premier. And then we'll just proceed with the, yes, yeah, okay. It seems everyone is here, but nature just does need to allow members who've been seated here just a bit of comfort break, just 5 minutes. Please, I will suspend the House until 5 minutes past 12. Thank you. I'm sure many of you are. It was a good comfort break. Now we move to the next order, and I recognize the secretary to do so. Mr. Stemmen.
Debate on vote 1, Premier Western Cape Appropriation Bill.
Thank you, Mr. Stemmen. Honorable members, I now recognize His Excellency, the Premier of the Western Cape, Mr. Allen Wind.
Thank you very, very much, Mr. Speaker, to the honourable members of the House that are here, the opposition, members online, to the members of the media, to all of the citizens at home, to the DG and the CFO that are here today. Thank you very much for this opportunity to put forward the budget for the Department of the Premier, a budget that is going to push forward for you, the citizen in this province. Speaker, the vision of the department is to enable and lead a capable Western Cape government. We aim to do so by embedding a culture of innovation and collaboration in all that we do to achieve this. We are guided by our values of being caring, competent, innovative, responsive, and an accountable government that acts with integrity. We do this in the very best interests of the citizens of this province, and all that we do, we also do in the very best interests of our country, South Africa. Speaker, we are driving innovation and collaboration within the government by leading the response to the Provincial Strategic Plan, the Provincial Recovery Plan, and by driving our vision-inspired priorities, or VIPs, and specifically in this department, VIP 5. I also sometimes think about these VIPs as not only vision-inspired, but also values-based vision-inspired priorities. Everything must be anchored in our values. Speaker, the department does this by providing support in corporate services, including legal services, corporate communications, human resources, internal auditing, enterprise risk management, and provincial forensic services, and of course, not forgetting IT support. Speaker, this department is the center of our government. To ensure that we deliver these critical services, the department's main budget allocation for 2022-23 is 1.825 billion rand. I'm pleased to note, Speaker, that this is a 4.6% increase over and above the 2021-22 adjusted budget, and will assist us in service delivery mitigation and the implementation of VIP 5, or creating a culture of innovation and collaboration. And this increase, Speaker, I must thank the Minister of Finance, Minister Mania, but I must go further than that. You know, in preparation of this budget, as we have seen over years, and specifically exacerbated by this pandemic, you go into the process with a bit of angst, because you know that we are generally not going to increase our budgets. We're going to be cutting. And this year, it's a bit different in this province. And I really want to thank the Minister. I want to thank the Provincial Treasury. I want to thank the ministers, the HODs, the CFOs, because much of this is not only because SARS managed to get some extra income through commodity sales, but in actual fact, through good governance, responsible governance, disciplined governance, that unlike other parts of the country who run out of their budget before the end of the financial year, they can't even feed, as we heard in this previous debate, can't even feed citizens in their hospitals. They run out of funding because they don't have that good governance background, that don't have that good governance basis and foundation, those disciplines. And so I want to use this opportunity to celebrate the 4.6% increase, but also to thank everyone across this government for the hard work in making sure, and the tough choices that you have to make in making sure that we don't only get those clean audits, the unqualified audits, but that we also, through that discipline, we actually end up making a difference in our budgets that can only make it better for you, the citizen in our province. Speaker, by increasing our allocation towards risk mitigation, and it is really important that we understand this important task in a government. We will be able to prevent breaches and targeted cybercrime. Cybersecurity breaches pose a significant threat to the Western Cape government and our residents, who are becoming increasingly dependent on our digital platforms and our digital channels. That is why information security has now been elevated to a provincial strategic risk. During the past year alone, 2 significant cyber attacks were successfully thwarted. We do, however, expect this to increase due to the growing trend of cyber attacks worldwide. It is a big issue, and we've seen that in this last year. We saw it specifically a cyber attack that attacked our very port here in Cape Town, and that halted exports. It had massive economic and brand damage to our region. So we have to make sure that we are preparing more and more for this new environment that we're moving into. And especially because of COVID-19, how this new way of work really launched us into the 4th Industrial Revolution. And so we have to take it very, very seriously. The allocation for risk mitigation over the medium term includes 40.039 million rand for 2022-23, 80.98 million rand for 23-24, and 71.492 million rand for the 2024-25 financial years. A further 2.5 million has been allocated as a contingency should any external expertise be needed, over the next 3 years. I also want to take this opportunity to really thank our team and Speaker, through you and the DG, the vigilance, the on the job 24/7, making sure that we are mitigating that risk, and of course through this budget actually just taking it to a new level. Speaker, in prioritizing IT infrastructure, the department's broadband project will continue driving the delivery of a high-speed network and connectivity specifically into our rural areas. This, along with free public Wi-Fi service, will ensure that vulnerable communities can bridge the digital divide. Speaker, a feasibility study to the value of approximately 20 million rand is currently underway to determine how best to improve internet services to all of our people across this province. The feasibility study will be funded by the United States Trade and Development Agency. It will further bolster the Western Cape government's broadband infrastructure project by assessing the economic and technical viability and deploying new broadband infrastructure across the province. It will also assess potential ownership and operation models for future broadband deployment. And, obviously we have to try and project what's going to happen into the future in this very fast changing and dynamic world. Practically, this will empower those living in areas with limited internet access by enabling them to apply for work opportunities, study, research, and improve their overall career prospects. I look forward to launching this innovative project in May through this signing of the grant. We'll do that in a ceremony. Perhaps here I must also once again thank Will Stevens and of course USAID, who have on a number of occasions come along with solutions for us and helped us in many ways in making a difference for the citizens in this province. Speaker, through VIP 5, an area in which we have also received an additional budget allocation, we are determined not to waste the lessons and the innovations that were born because of this COVID-19 pandemic. And I'm not going to go through them, but I think everybody is aware some really amazing innovations that came out of this pandemic time by all of our departments across this government in making sure that we responded, but also using this opportunity to innovate. The COVID-19 pandemic not only changed the way we live, but the way we work too. This resulted in the need to create a new way of work. In creating a new way of work, we are focused on what capabilities are required to foster greater innovation in service delivery and embed a new culture benefiting our residents. This approach will be embedded in all 4 recovery plan focus areas and is intended to shift mindsets and include the behaviors required for the successful implementation of the recovery plan. During the pandemic, innovative and collaborative solutions were speedily identified to improve internal operations and citizen-facing service delivery processes. We will therefore be finding ways to become a smarter and more agile government. To that end, the new way of work and culture change programs have been allocated 4.3 million rand through the adjusted budget to promote a client-centered culture, innovation for impact, integrated service delivery, governance transformation, talent and staff development, and transversal foresight. Practically, Speaker, this will include an allocation of 2 million rand towards Provincial to fund innovation projects, especially the reconfiguration of the provincial treasury instructions and the establishment of an innovation hub. That work has already begun, and I was very happy that the DG facilitated that top management meeting and meeting everybody involved in the transformation of Provincial. Speaker, a skills audit to be conducted among senior managers to be followed by middle management. This is to ensure alignment with data in the future fit skills strategy in line with international best practice. Speaker, it will also be forming partnerships with local and international higher education institutions and training providers, which feature prominently in the new PTI strategy. The final recommendations will be received by the 30th of November this year. Speaker, during my SOPA, I committed this government to listen more to the people it serves. To this, aligned with our vision of being more collaborative and innovative. That is why each program in the department will now report quarterly on the results of visits to frontline service delivery sites across our province and write an improvement report per site to benefit residents who use those specific sites. And or those citizens will then, through this process, be able to witness the changes that come about. This could include visiting clinics in Hanover Park or Tusong centers in Beaufort West, and it will be conducted by chief directors and program managers. These reports will contain observations, recommendations for service delivery improvements, and this will ensure that the service delivery becomes more accessible to residents, that there is an improvement in frontline services, and most importantly, that we are truly listening to the people of our province. And Speaker, here, I also want to add that it is not necessarily only our own frontline services. We must be bold enough to go further than that, to, for example, go to a SASSA queue. And here I must also ask this legislature to also join us in helping in their oversight role in improving these services at our frontline spaces, but also any frontline space where a citizen of this province is perhaps facing an issue. I think about the SASSA queues, I think about perhaps the SARS queue. Those of you that drive past the SARS office at the bottom of town, just up from the convention center, will generally see a queue around the building. We need to visit, we need to understand. It's not an announced visit, but make recommendations, and let's send those recommendations to Ed Kieswetter. I'm pretty certain he will embrace them, and at the end of the day, just from that visit, we could actually improve the citizen's life. I think of the deeds office here in the city, something that really does hamper our economy, and of course we have to change efficiencies and effectiveness there as well. So let's use this platform to really make a difference in the interests of our citizens. Speaker, through this budget, we will further be implementing the commitments made during the SOPA, which will include the establishment of a new infrastructure and a new mobility department, a special unit dedicated to violence prevention, and the renaming of the Department of Community Safety to the Department of Police Oversight and Community Safety. We will also now, as the Minister announced a short while ago, be renaming the Department of Health to the Department of Health and Wellbeing. And can I also say that this is something, as the Minister said, we've spoken about for a long time. I'm really glad that it has happened. And, you know, it was really exciting that it happened through the consultation process. You know, we were talking about the Violence Prevention Unit, and the department themselves said, isn't it about time we added and Wellbeing to their department name? And so thank you to that. Thank you to those involved. And I really am looking forward to this journey, this new part of our journey here in the province. Speaker, during the SOPA, I further outlined the Western Cape government, that the Western Cape government is guided by its 3 North Stars of jobs, of safety and well-being, which are critical in our recovery. This department is playing a part to promote safety through the police, the policy and the strategy unit. Speaker, that unit will continue with its researching, its legislative and its policy amendments to reduce alcohol harms, the support that it gives to the Department of Community Safety. It will continue partnering with the Department of Social Development, DSD, to develop norms and standards and improve family strengthening programs and referral pathways here in the Western Cape. The Minister continues in her trips around the province to highlight these issues that are facing our citizens, and this department will continue with its support there. We will continue commissioning research to map all current youth and youth at risk programs offered in the Western Cape. The unit has been allocated 400,000 Rand in the 2022-23 year on this project, and it will work in partnership with the Department of Cultural Affairs and Sport and the Department of Social Development. This unit will also continue partnering with the Provincial Department of Education, with DCAS and the University of Cape Town to pilot the VPI at schools, Violence Prevention Initiative at schools, behavioral program in schools to give young people the tools to regulate emotions, to improve mental well-being and reduce violence. The pilot will be rolled out in 50 high schools in priority areas, empowering approximately 2,000 learners. Just short of 2 million Rand has been earmarked in the 2022-23 financial year for this program. Speaker, the Children's Commissioner, Christina Nomdi, is further playing a vital role in promoting safety through her office's work, where she works with child participation strategies, for which she has already started gaining international interest. This requires children to participate in the work of the office of either attending a community child rights workshop, contributing to consultations with children, or becoming a child government monitor in the office of the Commissioner. For the 2022-23 adjusted budget, a total of 10.413 million Rand will be allocated to the Children's Commissioner's office, of which 6.754 million Rand has been allocated towards the compensation of employees. This also includes an additional 1 million Rand to fill posts, empowering this office further. Thank you and well done, Ms. Nomdu, for the important work that you do in promoting the rights of our children. The second recovery area in which our department is playing a key part in supporting well-being. That is why earmarked funding has been allocated to optimize the Western Cape government's communications and ensure that its messaging is impactful and responsive. A total of 25 million Rand has been allocated towards strategic communications. The communications which result from these allocations empower residents with the necessary information to get, for example, vaccinated or practice the necessary behavior change, and of course to promote personal responsibility. This is critical as we begin to normalize our response to the pandemic and focus our attention on economic recovery. Speaker, included in this allocation towards strategic communication is the continued rollout of the department's anti-gender-based violence campaign, which aims to foster awareness of sexism, misogyny, and GBV, which presents itself in everyday life, calling on men to take a stand against it. Our province, and indeed our country too, are plagued by GBV. Speaker, we have normalized treating women and members of the LGBTQIA+ community as if they were objects and not human beings. That is why we are taking a stand against GBV through this important campaign that specifically speaks to and encourages men to play their part in ending GBV. We need to confront this issue head on, and all of us, every single one of us in government, in private sector, citizens of our province, every one of us need to tackle this head on. Speaker, a future commitment to promoting well-being, we are continuing to provide in-house telephonic psychosocial support through the department's employee health and wellness services to those in need of support. This support is provided through our designated call center. Also a really, really valuable service. And you can feel it when you speak to people from a call center or people who receive calls from this call center. Speaker, the total support provided by this program since the start of the pandemic has benefited particularly those employees serving on the front line. A total of 67% of services rendered since the start of this pandemic were provided to employees in the Provincial Department of Health. And you heard the Minister of Health speaking about it in the previous debate. It is those frontline workers that have been on duty for over 2 years now. And of course, it's not over. We're still in the middle of this. And so that is why this is such a critical support service. Speaker, 29% of the officials are from the Provincial Department of Education, who again also have always been on the front line, dealing directly with our children, their parents, and this pandemic during some very, very difficult times. Speaker, we have seen concerning mental health statistics due to the pandemic, which is why we are continuing to provide our employees well-being. The department is also recruiting wellness interns to assist citizens at the coalface. To this end, 3.261 million rand was allocated for the 2022-23 financial year towards mental health services. Because it's not only about those frontline workers in government, it is also about our citizens. This is a service for you. Speaker, a key stakeholder in ensuring that safety, jobs and well-being are supported is local government. However, a wide range of challenges exist impacting service delivery at the local level. We need to support local governments in addressing any challenges they face. For this reason, we have earmarked funding for governance and legal advisory support to municipalities to promote stability following the 2021 municipal elections. This includes an allocation of 5 million rand for local government assistance, 2.5 million rand for legal advice, and 2.5 million rand for forensic assistance. By improving local government's ability to deliver services, we will ensure that residents can live a life with dignity. Speaker, the Western Cape government is dedicated to ensuring that our province's local governments thrive, particularly where challenges are identified. That said, we will not tolerate corruption where it rears its ugly head. Our duty as a provincial government is to serve the residents of this province, and should we identify corruption at the local level, we will immediately act against it by using every single tool at our disposal. Speaker, one of the things that I have long called for to promote jobs is ending the national state of disaster once and for all. There is still no hard commitment by the President to end this national state of disaster by the 15th of April. The removal of some restrictions on the economy should not be viewed as a license to dither yet again. The state of disaster is an extraordinary measure that cannot be extended indefinitely. Speaker, the Western Cape government is closely studying the proposed health regulations that will be introduced under the existing public healthcare legislation, as mentioned by the President. We will push back hard against any measures that hurt the provincial economy and which are not rooted in the best possible science or scientific advice. Factoring in all recent evidence, it cannot be allowed to be a backdoor to sneak unnecessary disaster regulations back in again. Speaker, as I close off, I want to acknowledge the resilience shown by those working in the events, the hospitality, the tourism and the catering industry, our artists, what I call the experiential economy. I really know that these last 2 years have taken their toll on you, on your industry, on the people that have lost their jobs in that industry. And I really want to say that while it has been crippling, we must be there to support you, to open up again. And I think those last comments and last changes have already given us a step forward, and we must embrace in helping all of you in this experiential economy claw back those jobs that we have lost. Speaker, as a provincial government, we will continue to play our part ensuring that you can bounce back stronger than ever. And an approach to supporting you will be guided by our culture of collaboration and innovation. And then, Speaker, finally, before tabling this budget for debate, I would like to say, first of all, to the Chair, thank you very much for the role you play, and of course the Standing Committee, and of course need to continue to play. As I've said, one of these new innovations that we want to bring into government is actually unannounced visits to the coalface. I think this committee should be doing exactly the same thing. I also want to thank the Director General and everyone in the Department of the Premier. I want to thank my office and everyone in my office. I want to thank each and every public servant in this province who has gone above and beyond the call of duty over the past 2 years. I want to thank you on behalf of the citizens of this province. Thank you, Speaker.
Thank you, Honorable Premier. Just going to request that we move the stage. The Honorable, the Leader of the Opposition, has requested to speak from the podium. So there's a mobile podium here, Honorable Members. It is moving to his chair, to his desk rather. Thank you, Honorable Members. Order. Honorable Members, I now recognize the Honorable, the Leader of the Opposition, Honorable Dagmar.
Thank you very much, Speaker. Also greetings to the Honorable Premier and other members in the House and outside. Speaker, I want to actually invite the Premier. You know, he comes here today and he talks about, you know, queues at SARS, and we support making proposals to reduce those. But why doesn't this Premier talk about the lived reality of potholes, of leaking drains, of sewage spewed across the streets in many of our communities, running drains, the filth, the state of our water? He doesn't mention that. And I challenge him today when he responds to come with the ANC, to come with me as leader of opposition and our other MPLs, to actually see the service delivery which is going on in the biggest city in this province. We've seen the absolute unwillingness to even confront the city when they set up a concentration camp for the homeless. That is what the Premier should be worried about in his department in terms of their oversight role. So make the proposals about SARS, that's good. And Ed Kisvesa, I'm sure, would listen. but come with us and actually see the reality of Cape Town. That is what I challenge you to do. And while we're about it, let's go and look at the Philippi Stadium, which has been allowed to actually, you talk about wellness and well-being. Go and look at the Philippi Stadium and the absolute state of uncaring and the unkempt nature of that stadium, right in the middle of our communities, which is supposed to serve. And that is the problem, Premier, because in what you and your department do, there's a thread of denialism about how race, class, and gender have impacted on the lived realities of people and the inequalities which actually exist. It is the Premier and his department who are supposed to give leadership in the Western Cape, not just in regard to this budget that we are debating today, but in regard to the province as a whole. We are asked, Speaker, today to approve 1.8 billion rand, 103 million to support the Office of the Premier, 86 million for provincial strategic management, 209 million for people management, 1.2 billion for the Center for E-Innovation, 126 million for corporate assurance, and 54 million for legal services. Last week during the second reading debate, I said that budgets are not neutral. They reflect choices and the ideological orientation of the governing party. This budget is there to support the leadership that the Premier's department is supposed to provide for the entire province. I do not doubt, Speaker, the energy of the Premier, but what concerns me, Honourable Premier, is that you are leading this province deeper and deeper into inequality. What concerns me, Premier, is your blatant disregard for the redress provisions in both the national as well as the provincial constitution. I'm arguing today, Speaker, that the conduct of this provincial government is in certain material respects unconstitutional. This is because the party that the Premier belongs to does not believe in redress for those unfairly discriminated against under apartheid. So that is why he would not be concerned about potholes, about the stench, about the filth, about blocked drains in the city of Cape Town for hundreds of thousands of people. This Premier is thus under instruction to undermine employment equity, broad-based black economic empowerment, land distribution, as well as the minimum wage. Speaker, in the Portfolio Committee discussion, the Honourable Premier could not name, and I hope he's come here today with the name, of a single provincial law or policy that, as required by the directives of Provincial Policy Section 10, enshrined in our provincial constitution, actually advances those who were victims of unfair discrimination. I'm looking forward to him just mentioning one of those policies or provincial laws. It is obvious that under your leadership, Honourable Premier, through the Speaker, that this province has finally abandoned any pretense of establishing a representative public service in our province, seeing coloured, African and white public servants fairly represented at the senior management level. You've abandoned this. Instead, you have continued using the Zilla term fit for purpose in the most cynical of ways to block employment equity in your own department and in this province. There's irrefutable evidence of how the DA has practiced cadre deployment and in the process deliberately undermined employment equity. There's proof of that. And on that score, Speaker, we as the ANC will now launch a PIA application to obtain all the minutes and correspondence regarding DA cadre deployment from 2009 to date. This application will be launched in April. Speaker, the Honourable Premier cannot make an oath to uphold the national and the provincial constitution and the laws of this country and the province, and yet simply undermine those laws that his party does not like or support, because that is what is happening. At best, you have allowed senior officials of this very department to preside over the culling of African public servants in the Western Cape. The tragedy is that a representative and diverse public service would actually lead to a more capable, a more in tune with the needs and demands of the communities that this government serves. But the Premier must face up to the fact that he has continued the cynical approach of the Premier that came before him of so-called fit for purpose, and in the process undermined the capability of this government. It is a tragedy, Speaker, that the Premier has abandoned any notion of the Western Cape as a home for all of its people. So, Speaker, this is my first concern with this budget. The department, which is supposed to be inclusive and representative of the people of this province, has no plans in its own annual performance plan to change this. Not a word about employment equity. When black and coloured prospective tenants, for instance, are blocked by racist landlords in this city, there's not a whimper of objection from the Premier's office. Premier, you lead a government which has never said a word to defend the Palestinian people against Israeli occupation and the brutality used to deny their very right to self-determination. This legislature has never lit up this building in green and black and red and white of the Palestinian flag. And worse, Speaker, it is you, Honourable Speaker, who refused to debate the Palestinian issue when that was requested by Honourable Member Brinkhuis from Al Jamaa. And we have a situation where the Honourable Mackenzie, who is sitting in this House, wanted to call to order a staff member of this legislature because she was wearing a Palestinian flag, a Palestinian scarf. Yes, it is the Premier, without any authority to do so, that decides to boycott Russian Federation diplomats. By doing so, this government and this legislature undermines the efforts of President Ramaphosa to assist with negotiation and mediation to end the war in Ukraine, which is what we need to do. Instead, his cabinet slavishly backs the United States of America and NATO's approach. In essence, this DA stands exposed, in fact, as the shop stewards for neocolonialism and right-wing liberalism. In essence, it is actually, Speaker, about seeing white lives as more valuable than black ones. I want to place on record here today that I support the position of our government not to take sides in this war. We trust that the talks in Turkey today will result in a cessation of hostilities. This war must come to an end. The human suffering must stop. But the cabinet's double standards, the duplicity and the racism is there for all to see. Also from you, Speaker, for refusing this House to debate the Palestinian issue and then without consulting us, wanting to light up this legislature. What about lighting it up with the Palestinian colors? Why not? Why the double standards? Why the hypocrisy? Let us support President Ramaphosa's efforts to bring peace and security to the Ukraine. As we discuss this budget vote today, it is your party, Honourable Premier, that will...
Thank you, Honourable the Leader of the Opposition.
Thank you, Speaker. Speaker, I'm rising on a point of order. Is it parliamentary for the Leader of the Opposition to engage you where you in the chair cannot have an opinion or rebut his claims? Thank you, Speaker.
Thank you, Honourable Minister Mitchell. It's always very tempting because members have this one opportunity to debate. He's not part of the POC, the Honourable the Leader of the Opposition, but he knows the rules and is breaking his own rules. So for highlighting that, it's very important because the Chief Whip must engage the Speaker in the platform that has been set for that purpose, but not here. And I would have expected that his whippery from the majority, from the opposition party, would actually draw his attention to that. So thank you for protecting the presiding officer. That's exactly what the rules predetermine. Will you please proceed, Honourable Dagmo, with that
thank you.
Determination so that we do not draw the presiding officer into the debate because it's procedurally unfair and it's flawed.
Thank you, Speaker. Speaker, could I just be reminded about how much time I still have? I've got 16 minutes more.
I will tell you now, order, honourable members. Order, honourable members. You have
11.
You have used 9 minutes, 18 seconds. So you are left with just over 7 minutes, just over 6 minutes.
Thank you, Speaker. As we discuss this budget vote today, it is the party of the Honourable Premier, the DA, that will tomorrow move a motion of no confidence against President Ramaphosa's cabinet. This provides us with a good opportunity to actually reflect on what has been achieved under the leadership of President Ramaphosa and compare this to the leadership as provided by the Premier and what is being done in terms of this budget. One of the most significant articles which captures what President Ramaphosa and the ANC have achieved since his election at the ANC's 54th National Conference in 2019 at Nasrec was written by Dr. Oscar van Heerden, Deputy Vice Chancellor at the University of Fort Hare. The article tells the story about the race between the tortoise and the hare, and Dr. van Heerden writes, and I quote, "Since he was elected in February 2018, President Ramaphosa has taken decisive steps to end state capture, fight corruption, and rebuild damaged public institutions. With regard to his promise to rid us of corruption, these are some of the measures. He replaced boards in several captured SOEs with competent, credible people. Eskom in January 2018, Denel April 2018, Transnet May 2018. He instituted the Nugent Commission of Inquiry into SARS, which found severe governance and operational failures in May 2018. He appointed new leadership at the Directorate of Priority Crime Investigation, the Hawks, which has restored the credibility and stability and led to tangible action against alleged corruption. He appointed a high-level panel on the State Security Agency towards rebuilding and restoring the integrity of our intelligence services that had been stolen dry by the enemies of this country. Yes, enemies, the enemies. Yeah, the enemies. That's right. He appointed a high-level panel, and these are being implemented. He then rightfully terminated the employment of the then Commissioner of SARS, Mr. Tom Moyani, replaced him with Mr. Kisvetter. Following the Nugent Commission, and if it doesn't stop there, he appointed a new National Director of Public Prosecutions. We now have a new Director of Public Prosecutions in the Western Cape. I want to congratulate Advocate Bell. The President then appointed the SIU Special Tribunal to expedite civil claims against corrupt individuals and the recovery of stolen funds. He removed Advocates Jiba and Mkhwebi from the NPA based on the findings of the inquiry into their fitness to hold office. He then established the National Prosecuting Investigating Directorate, and I will provide a copy of all these achievements because it is the Premier's party who tomorrow want to put in place a motion of no confidence against the National Cabinet. And I want to say specifically, I want to say that the Premier,
Order, Honourable Member.
that in terms of doing all of these things, this was the President and his Cabinet. But now, and the particular thing that I would like the Premier to take note of is that when you say that the tortoise is too slow or that he has done very little in the way of advancing the fight against corruption, or better yet, you say that he has no backbone, he's completing this race way ahead of the hare. President Ramaphosa has achieved the above, working with his cabinet and supported by the ANC. I would like the Premier and his advisors to pay particular attention to the conclusion of the article by Dr. van Heerden when he writes, "The lesson of the story of the tortoise and the hare is that you can be more successful by doing things slowly and steadily than by acting carelessly and quickly." It is clear that as we discuss the budget of the Department of the Premier, we remind him of the quick fix and careless announcements that he made in his SOPA address. Without adequate consultation, he simply announced new departments. It now appears that there's uncertainty, division, and confusion, not only amongst officials within the provincial government, but amongst some of your own MECs. More haste, Mr. Premier, less speed. Too little detailed planning, no concrete impact, form, but no substance. Just like the safety strategy, we have never seen up until today a detailed business plan with measurable outcomes for the provincial safety plan. Member Kama exposed this yesterday. There's no accountability for what each MEC is supposed to do. That's what a Premier's department is supposed to do. What happened to the safety cabinet, Premier? When last did it meet? That is your job of your department, Premier. Hold your MECs and their departments accountable, not demoralize and confuse them with changes that were not thought through, that were simply media announcements. More haste, less speed, less impact on the ground compared to what the President has actually achieved by simply doing what he's supposed to do. You are failing because you have failed to plan in detail. The allure of quick fixes, which can be spun in the media, is tempting, but they are fast losing their sparkle. The soap announcements, what we can call shiny, happy people announcements. No informing theory, no detailed analysis. The energy of the hair is misplaced. And tragically, that is why this government is failing. It is form over substance. It is careless and not thought through. The department trumpeted community Wi-Fi access. The people of the Western Cape were promised community Wi-Fi hotspots in every ward. One of these instances is the broadband rollout. This was marketed as public broadband rollout for public Wi-Fi access. Then it changed to Western Cape broadband rollout and now WCG broadband. With billions spent, we can safely call this project a failure, as it has done nothing other than to upgrade provincial government and local government buildings. Not a single community Wi-Fi hotspot has been set up. Rather, some government buildings have offered public Wi-Fi access. And there's a big difference between that. One official even admitted that while the service is available 24 hours, its range is only 80 meters. So what was once referred to as a mechanism to provide public Wi-Fi hotspots across the province,
members,
it now seems to have been done only in a limited way.
Honorable Dagmar, you've got less than a minute to conclude.
Yes.
And again, please address the presiding officer.
So that is why, Speaker, we as the ANC will insist on public Wi-Fi hotspots within our communities that are planned to take into account safety, proximity, and 24-hour access. In the 406 wards in this province, in those where poverty, inequality, and unemployment are worse, the ANC calls for public Wi-Fi hotspots within each VD in the ward. We will mobilize all councillors in these wards, irrespective of party affiliation, to demand accessible and safe public Wi-Fi hotspots in every VD, in every ward, which you have failed to do because you have failed to plan.
Thank you very much. Order, honorable members, order. Thank you to the leader of the opposition. Before I move to the next speaker, there's a hand, Honorable the Deputy Chief of the ANC.
Honorable Speaker, thank you very much for the opportunity. Honorable Speaker, I just wanted to check with you. The Honorable Minister Mitchell raised on a point of order that the Honorable Leader of the Opposition may not address the presiding officer without the presiding officer having an opportunity to respond, which you ruled was correct, and you then also criticized the whippery. Could you please just indicate, Honorable Speaker, which rule basically states this, just for further reference, and so that we can learn.
Thank you, honorable members. Honorable Said, order, honorable members. You see, when you start dealing with the presiding officer in that manner, you touch on Rule 59. And then other rule that is affected by that, it is Rule 62. So it becomes very difficult, and I think that's why we need to deal with the rules correctly. And we continue to improve on our rules because they're not static. But when we have them, and whilst we have them, we need to apply them and respect them. So that is the basis for which I then made that determination when that point order was raised. If it was not raised, I was not going to do that, because I expect the whippery and the honourable members to be active during these debates. But I was going to defend myself when I speak in the POC as the body where I account to for those matters. But I thought it was important that I rule on that matter in the manner in which I have done so. Thank you very much, Honorable Said. Honorable members, I see order, honorable members. I see there is another hand in the online platform. Honorable Kama, what's your point of order?
No, thank you, Honorable Speaker. My
members, Honorable Kama, you may proceed.
Yes, thank you, Honorable Speaker. I had actually raised my hand before Member Said and wanted to check whether perhaps the directives you had given on how we continue with the hybrid or online system, if we're allowed to clap for that wonderful speech of the leader of the opposition, because I'm tempted to do so.
I'm sure you'll clap alone there. It's difficult. Honorable Kama, if I may, honorable members, order. If you recall in the directive that I issued on the 17th of April 2020, the difficulty was that if you clap on the microphone and everyone claps, then there's chaos. But for the honorable members who are in the hybrid venue, as you will recall, I made the same determination in terms of the ruling when we were in the Bergrivier municipality in Veldrif, that members, we cannot just clip the wings and curtail democracy when members want to freely clap in the chamber or in the hybrid venue. But online, it's difficult. So hence, then it is outruled in terms of the determinations as approved by this House in 2020. So, but you can clap there alone and as another member, but switch off the microphone. But thanks, Honorable Kama, for creating that, indication. Yeah. May I then proceed, honorable members? We are now at 1 o'clock almost. We have 4 minutes before. I don't like breaking the order, honorable members. Don't compete with the presiding officer. Personally, my preference is not to break in the middle of a budget vote. However, we'll see how far we go with the remainder of the speakers and then determine what time we break for lunch. Because the reality is that we have service providers and we don't want to have fruitless and wasteful expenditure on the food that has been prepared for members and some of the support teams here. May I then say let's proceed to the next member, Honorable Xhego Ngonde. Ukhona Ngonde? All right, honorable members, in the absence of Honorable Xhego, we'll see whether he pitches before we conclude on the vote. We go to Honorable August.
Honorable Speaker, over the course of the past couple of weeks, I've listened to members constantly referring that the Western Cape is the best run province in comparison to other provinces led by the ANC. As residents of the Western Cape, our people are suffering most as we constantly measure ourselves up to other provinces. It is true that the standard of leadership in South Africa is extremely low, but this in no way gives the DA the moral high ground when it comes to service delivery. What we need to do is demand accountability, not by comparing this province with the rest of the country, but by ensuring that we remain at the forefront of meeting the basic needs of services to safeguard the human rights of our people. The Office of the Premier is an important channel in achieving these interventions, as it focuses on the developing strategy and achieving sound governance. Speaker, today I would like to call on the government to consider finding commonality amongst the policy prioritizations and the budgets that goes with it. Entire departments are operating in silos, isolated from one another, and as much as that is how things have been since the dispensation of democracy. We have learned that working alone is equal to working against. I'm urging this administration to start focusing on the functional programs between Department of Health and Social Development, tackling crime by providing social interventions and community development initiatives. The Transport Department should be able to work with tourism and economic development. This government and the Office of the Premier need to start considering programs that share in the collective objective of your departments, and perhaps this year we will start seeing service delivery for the people. Thank you, Speaker.
Thank you, Honorable August. You were within your time limit. I appreciate that. Now we move to the Honorable Mare Akbare. All right.
Thank you, Speaker. I would just like the Premier to reflect on what he says. He's always guided by the North Star. I want him to start looking south. Let's look at the Western Cape, which is not to the north, Premier, and tell me the following. Here in the Western Cape, the big issue is unemployment, poverty, and crime. Those should be your focus if you look south and not north. We had the first, for once, we have a court ruling on the High Court about the equity laws, labor equity laws. I was very much involved in that, and we won the court case with the help of Solidarity Trade Union. Are you sure the Western Cape public and private institutions comply with provincial demographics when they appoint people in our hospitals, in our schools, in the private sector, the supermarkets? Are they compliant? And does it worry your department if they are not? Secondly, our people are already in a state of shock because of COVID. Poor, unemployed, and now we allow the city of Cape Town to cut water. If you're unemployed and can't afford to pay for water, you are put on a drip system. Does it bother you, Premier, that people are told to wash their hands, wash their faces to prevent them from getting contaminated with COVID, but they got no water because it's a drip system? What is our Minister of Local Government doing about it? Does he get conditional grants in order to subsidize the water if people can't afford? Thirdly, I want to ask you, Premier, the non-filling of posts of Minister Albert Fritz. Are you going to look at it? Is this a money-saving exercise not to fill that position? Or don't you have competent people on your side that you can appoint in that position? What is it, sir? Thank you.
Thank you. Thank you, Honorable Mare. Honorable members are now recognized. Honorable Brenkes.
Thank you very much, Honorable Speaker. Bismillahir Rahmanir Rahim. The well-being and holistic growth of children is a matter which needs urgent attention in the Western Cape. The Children's Commissioner, Mrs. Nomdo, has expressed that it remains a challenge to deliver on her mandate due to lack of resources and capacity constraints in the office. It is worrying that the Standing Committee is not exercising proper oversight to address the challenges of the Children's Commissioner is faced with. The committee's 2020-21 annual report revealed that 3,000 calls to the Children's Call Center has drastically increased to 460,000 per year. There is an urgent call from the Children's Commissioner to fully capacitate the office. She must cover a vast area, and the province should look at providing the Commissioner with a helicopter to reach more areas. The Western Cape has a serious waste problem, and the department has admitted that the province is running out of landfill space. The situation indicates the need for an appointment of an environmental commissioner. Why has the provincial government removed the original amendment proposed for the appointment of an environmental commissioner? Residential areas with backyard dwellers and informal settlements are not receiving adequate service delivery in terms of waste removal. There are dumping sites among residential areas on the Cape Flats which are health hazards. If the current legislation in place to deal with waste management is sufficient, as the Honorable Premier has been stating for the past few years, then why do we have these dumping sites on the Cape Flats? Waste removal services are obviously inadequate on the Cape Flats. Thank you, Speaker.
Thank you, Honorable Brenkes. Your time is up. Honorable members, I now recognize the chairperson of the committee, Honorable Botha.
Thank you, Speaker. We from martial arts now to helicopters. Speaker, I hope that with the same enthusiasm, the leader of the opposition will also call an end to the war of corruption that his party is engulfed in. And then, Deputy Speaker, Speaker, can you protect me, please? Thank you.
I've been begged nicely, Honorable the Leader of the Opposition.
Yeah.
I will definitely protect you, Honorable Botha. You may proceed. You are protected.
Thank you. The Leader of the Opposition and I have a pact in the Standing Committee. So let's stick to that, Leader of the Opposition. Thank you. Speaker, and I hear the young lion saying that he is in support of the Leader of the Opposition. I think it is for the upcoming Congress, and I'm not too sure whether the Leader of the Opposition, whether he is a tortoise or a hare. And I'm just seeing this picture, this young cub lion supporting either a tortoise or a hare. So, through you, Speaker, aan die agbare oppositieleier, ek wil sê, jou onderrok steek uit. En ek wil ook daarby sê, dat, kyk wat se gemors, het die ANC in Cederberg agtergelaat. So, voordat jy voor my deur vee eers voor joune. Speaker, hierdie week, die ANC is in die media hierdie week aangehaal vir alle kwessies wat hulle liewer onder die mat sou wou vee. Agbare leier van die oppositie, jy moet verseker dat daar nog stemme sal wees om jou in te stem as die provinsiale voorsitter. Agbare adjunkleier, deur u, Speaker, jou onderrok steek uit. Speaker, a caring, citizen-centric budget. This role of a good and fair government is not to become a clunky machine and desperately trying to pull society along, but rather to be society's greatest ally and partner, offering opportunity, creating conducive environments for businesses, promoting safe communities, and protecting our most vulnerable is a role that the Western Cape government, led by the Department of the Premier, plays in making the Western Cape a place where everyone can prosper. For the 2022-23 financial year, the Department of the Premier has been allocated 1.25 billion rand to be the oil that smooths the way for this provincial government to service our residents by always placing them at the heart of its work. The department's primary role is to enable and ensure the delivery of strategic plans and priorities throughout the entire Western Cape government. The often unseen work of the department sees support offered to the 80,000 government employees, including mental health support. And it is pushing forward innovation and new ways of delivering the best services to residents. Consider the broadband initiative, which has a two-pronged effect, upgrading broadband capabilities at local municipalities and leveraging these to offer free internet connection to residents in the most rural of communities within our province. While we celebrate the access that this gives to residents, Oftentimes, we underestimate what this means for the local municipalities who are the ones at the coalface of service delivery. So, we must also welcome the allocation of 1.29 billion over the next 3 years for the rollout and upgrading of broadband and Wi-Fi services within our municipalities. But as we become more efficient, using technology to reach our citizens wherever they may be in the province, protecting the data and cyber systems must take priority. And so 240.6 million rand over the MTF have been allocated. We have seen how cyber attacks at our ports last year brought the maritime export and input sector to a standstill. Big banks have also been impacted by cyber attacks where customers' information has been compromised. Ramping up security to incorporate the new culture of hybrid working means that we can ensure that residents' data is safe. But protecting public money and ensuring the integrity of this government has been further increased by a 20.44% increase in the budget for the Provincial Forensic Services. Jealousy guarding our resources is key to stopping the entrenchment of corruption that we have seen in other governments across the country. And another 7.5 million rand has been allocated to support local governments in their legal governance and investigative needs. And Speaker, it should be pleasing to every member of this House that the budget for the Children's Commissioner has more than doubled for this financial year in comparison to the estimated budget for the 2021-22 financial year. More than this, Speaker, the budget for the 2023-24 financial year has increased by 2 million since last year. We want to see our children safe and thriving in the Western Cape, and we want a government that serves them all. This additional funding will further the Commissioner's reach and ensure that this government is held accountable for how it is serving our youngest residents. Speaker, the progress made by the Western Cape Safety Plan must be commended. Despite limited mandates and the undercapacitation of SAPs within our province, the Western Cape Provincial Government continues to push forward to keep communities safe and root out crime. Much has been said of the successes of the safety plan in the Cape Town Metro, and I commend the work the LEAP officers have done in assisting SAPs and other law enforcement officials in quelling and responding to violent crime in our communities. However, I would like to highlight some of the other communities that have benefited from the implementation of the safety plan. And some of this has been highlighted by the acting Minister of Community Safety yesterday in her budget speech. During a joint operation between the Malmesbury SAPS and the Swartland K9 units, on Saturday 25 March, 5 individuals were arrested for dealing tick and being in possession of ammunition. The very next day, the same K9 unit, in cooperation with the Malmesbury Crime Prevention Unit, led a joint operation that resulted in the arrest of 9 individuals for the possession of a firearm. The firearm was later identified as one that was booked in earlier and stolen from a police station. On Saturday, 19 March, members of the N7 Flying Squad Piketberg arrested 4 individuals after they were found with 5 shoeboxes filled with button plants with its street name Knopies. Due to the operations made possible by the safety plan, 5 individuals were arrested recently in Veldrift, who illegally slaughtered over 60 sheep within the space of 2 weeks. I have also received reports of sustainable, fruitful partnerships within the Bergrivier area, which was made possible due to the same safety plan. It is clear that the research-driven boots-on-the-ground approach to the safety plan is working, Speaker. It is evident from this budget that the Western Cape government, led by the Department of the Premier, is committed to serving the residents of this province with dignity and care. Speaker, the behind the scenes work of the Department of the Premier to support our provincial government and each and every local municipality in the Western Cape is the oil that makes sure the wheels of government turn to see a prosperous future for each and every resident within the Western Cape. All our frontline staffers who represents this Western Cape government, I thank you. Thank you to our DG, Dr. Harry Malila, who leads in this quest, Speaker. You have shown resilience in a time that this province needed it most. You have come up with innovation in order to service our communities. You are also evaluating the gaps and are addressing such. Thank you to my colleagues on the Standing Committee who will support me on the journey of chairperson to this Standing Committee. I also want to say, Speaker, that as chairperson, I am looking forward to welcome the Honourable Sayed to the Standing Committee of the Premier later this year. Speaker, I want to thank the procedural officer, Ms. Kamish Ahmad, for her support to who have made the decision so smooth and for her support. Speaker, the DA supports vote 1.
Thank you, Honorable Chairperson, Honorable Porter. Honorable members, I now recognize the Honorable Premier.
Thank you very much, Speaker. Appreciate it. And can I say thank you very much to each and every member that took part in this debate. And I would like to probably start in reverse with replying to the debate. So first of all, to the Honourable Chair of the Standing Committee, the Honourable Botha, thank you very much for your role as Chair and of course for your inputs. I wasn't aware of the Honourable Said actually becoming the main member on this Standing Committee, but I too join you in looking forward to welcoming him to the Standing Committee. And I presume that is going to be followed, that'll follow obviously the ANC conference. It's probably going to be a very quick conference because there are 3 branches that have to get together to choose the person to lead them into the next election. And I mean, you could probably do it on a WhatsApp group, but yeah, I look forward to welcoming you, the Honourable Said. Can I also say you commented on the safety plan, and of course there are some other comments coming up on the safety plan, which I will deal with as I get to 1 or 2 of the other members. But yeah, it's interesting because the safety plan, as we announced it on day 1, is an organic growing plan that continues to change. And of course, if you go to the previous debate where we spoke about the violence prevention unit, that's sort of just again another iteration of the plan and how it gets centered, learning from the Cardiff model, learning from the Glasgow model, learning from our own experiences. And I think Minister Mbombo actually did give everyone a bit of a workshop on that. So I won't go any further, but I will speak to the actual safety plan, the targets in a short while. I want to also say to the Honourable Chairperson who also spoke about Wi-Fi and the impact of Wi-Fi, and as well as the Honourable Dugmore. And perhaps I'll just mention our Wi-Fi rollout program. And of course, I think the Honourable Dugmore has been sent a few times the full report on it. But of course, we're now at 1,274 free Wi-Fi hotspots across this province. You know that. You see, Honourable Speaker, straight away he says linked to government. That's exactly because the school is in the middle of the community. The library is in the middle of the community. They are linked to that infrastructure because, of course, you must link it to some infrastructure. He doesn't seem to understand that. It is in the center of the community, in the center of the ward that he speaks about. And of course, the interesting thing about this Wi-Fi now is that you've got 3 gigs that are available free every single month to our citizens. The exciting part as well is that we're starting to see, we're only supposed to be doing it in September, October, where we're upping to 1 gig speed. But already it's exciting to see that 22 of our schools, and maybe even more by now, are already sitting at 1 gig speed at our schools. So it is exactly in the middle of the community. It's exactly the point that he raises. What he did raise was that some of them might not be 24 hours. And he was given the answer in the standing committee that where you have a 24-hour hotspot available at a school, wherever it is, what happens is people congregate around that space. And sometimes the citizens who live right there actually come and say, please, we've got noise at 3 o'clock in the morning. We can't sleep because everybody's congregated around the free Wi-Fi hotspot. And so what we do is we turn the aerial system so that people could then maybe be directed to another part of the circumference of that school or that library so that they can pick up their Wi-Fi hotspot. And if it's not possible, then what we do is we will have a 9 o'clock at night or something cut off for that specific point, because it's an engagement with the citizens and users. And of course, we need to be able to care for our citizens. We need to show them that we live our values. And of course, through that engagement, we might change 1 or 2 of those hotspots. But there are very few of them that actually operate outside of the 24-hour run. And maybe one other thing that's quite interesting, the other day I was with a report to the DG, and an interesting thing on our schools and the Wi-Fi usage of our schools. Do you know that the schools operating on our Wi-Fi system, if you take the volume of data that they use on a day or in a month, the schools in the Western Cape's volume of data for that period of time is more than the volume of data used by every other school in every other province put together. And this province uses more. So it shows you that the system is working. It's enabling our education system. It is enabling our learners to really make the biggest difference that we can. And of course, this is still ongoing. And as we've said now, we've got the support now through this funding grant, where we're going to go and interrogate our system once again. Say, well, what is the future going to look like? And what else do we need to do to get better and better? We've got to continually improve what we do, the services we give to the citizens of our province. And then, of course, Chair, you spoke about your onderhoek stick uit. I agree, but I'll get to that. I mean, you spoke a lot about that. You were answering the leader of the opposition and his hairy tortoise issues, but I will get to that just now. He was talking about more haste and less speed, or less speed and more haste. I'm not too sure, but the hair of the tortoise. But I will get to that shortly. But thank you very much, Chair, for your inputs. The Honourable Brinkhuis, thank you very much. Jeepers, I wish that it was that easy, that the committees in the debates we stand up and we just start allocating helicopters to people. But I don't think that is a possibility. Definitely not in our country at the moment. But I do support you, Honourable Brinkhuis, and say that, of course, we've got to make sure that we have budget available, that the office of the Children's Commissioner is supported. Of course, if you look at the budget in the budget book, and if you look at the support, you'll see 2021-22, and obviously this was at a COVID time. She had 6 million to set up her office. It's now gone up to 13.345 million. Then, of course, next year it's going to be 7.72 million. The year after, 7.45 million. And of course, on top of that, there's been some extra funding, as I announced today, another 1 million that'll go to more resources, specifically human resources, 1 million, and then 2 million the next year, and 3 million the year after over the MTEF for staff support. So I agree with you, but you can see in the numbers that support is definitely there. You also raised the issue around the Environmental Commissioner. And of course, this has been going on for a very, very long time. And again, it is about the regulatory environment we find ourselves in versus the budget that we have as a government and what can be achieved through this process. So, of course, in the Constitution, there's an Environmental Commissioner. Whether it's now where we sit many, many years later after that Constitution was written, in this specific government, while I sit on this side of the House, where the argument is that in actual fact, from the writing of that constitution to where we sit today, there's a raft of new environmental legislation in place that says, why would we want to just create another duplication and take money away from health or take money away from education to create this where it's not really necessary? But the same applied because, you know, at one stage, I used to sit on that side of the House where you're sitting. And I used to raise the same question. Why haven't you put an environmental commissioner in place? And the Honourable Dugmore was sitting on this side, and I remember the answers given by the Honourable Esop, who was then in charge that time, and she gave exactly the same answer, that quite frankly, there's enough legislation in place that we don't need it. That's exactly what she said. Go and have a look at the Hansard. I've already sent you a copy of her Hansard. I'll send it to you again if you want. But that's exactly what she said, and that's why we have taken this position. It's you know, based on the data, that's why we've taken this decision. But thank you very much. Then I want to move on to the Honourable Marais. Thank you very much, Honourable Marais, for your inputs. Yes, I will
Honourable Premier, you must address the presiding officer.
Chair, through you, Speaker, to the Honourable Marais. Speaker, could you let him know that I definitely will fill the vacancy from that was created when Minister Fritz no longer held the position. But of course, it'd probably be wise to do that after we've finished the budget, not in the middle of this process, but shortly that vacancy will be filled. So, Speaker, can you thank him, or through you, for pointing that out to me? I also would like, it's a pity that, so I can't really ask the Honourable Marais a question directly and get an answer, but perhaps as part of this reply, I will form my reply as a question to say it's interesting, and I wonder if it is his party's policy that for people who do in our municipalities receive more free water allocation than any other municipality in South Africa. They get the free water allocation, but when people don't pay for the beyond the free water allocation, they then get put on a drip system. They don't get the water turned off, it goes onto a drip system. But it seems as though his party's policy is it doesn't matter whether you pay for your water or you don't pay for your water, it should just be left on. And that's an interesting policy position. One would think that with that policy position, he might get more votes, but we'll have to see what happens in the next election with that policy of his party. He also says I must stop looking north and I must look south because I must focus on jobs, safety, dignity and well-being. Well, whether you look north or south, those are the focus areas of this government: jobs, safety and well-being. And I can assure you that south, north, east or west, they will remain the focus of our government and our recovery. We've got to get jobs back into our economy because with jobs comes dignity. With jobs also comes safety, but we've also got to focus on safety. And of course, dignity and well-being of our citizens is paramount. So that is the focus of this government. The Honourable Klecho, thank you very much for your inputs. You spoke about the system of how we need to work together. There needs to be cross-cutting programs and processes of how we govern. Well, I can assure you we still do. We do exactly that. And it was also an issue raised by Honourable Dugmore. We have extended cabinets for management of COVID-19, or perhaps when an insurrection is happening in our country, we put the management systems in place that we learned through COVID-19. We also have the PCF process where we meet with our municipalities. Of course, we've got our cabinets, and then we've also got those management meetings that you call MANCOs, which would be a safety focus or a jobs focus or a dignity focus, or of course a governance, a VIP5, a focus that we as a government are making sure that we are managing our government in the best interests of the citizens of this province. I also want to say that then to the Honourable August, sorry, I made a mistake there, Honourable Klecho, sorry, you didn't raise those issues, it was the Honourable August. The Honourable August, can I say to you, thank you very much. I think you're absolutely correct. We must not measure ourselves in the Western Cape against other ANC-run provinces. That's why we put these world-class measures in place. because we must do that. We must measure ourselves against other competitive regions around the world. That's why we've got regional partnerships. And quite frankly, I absolutely agree with you, because measuring yourself against the ANC provinces is not really stretching anything at all. But thank you very much for those inputs. And then I want to get to the Honourable Leader of the Opposition. Wat een? Nee, die een wat gepraat het. The Honourable Leader of the Opposition, thank you very much. I look forward to actually going with you. You said, please come along. Let's go and have a look. And absolutely, I want to go and have a look. Let's go and have a look. I'm happy to start. You said, come with the ANC. There again, I noted all three branches can come on this visit. We probably all fit in one bus. And we'll go to Beaufort West, and we'll go to Kannaland, and we'll go to these places, but we'll also go to places in the city, because there are issues. There are issues that where citizens face potholes, or they face sewage blockage problems. But it's interesting because I've been watching the city of Cape Town quite closely in the last couple of months, and I've been seeing a big focus on making sure that those issues that are being raised are being dealt with. Those potholes, the redoing of those roads, the dealing with the infrastructure issues around sewerage. Absolutely. So I'm happy to go and have a look. The Philippi Stadium, I actually have asked, and Minister Marais is getting a report on the Philippi Stadium to see exactly what the issue is there. I believe it was put out to Chipper United, and that perhaps they haven't managed it properly, but we'll go and have a look at it. Absolutely. Maybe we must go and have a look at what happened there, and how when trying to support a local soccer team, that maybe we're going to do it differently next time. But let's go and have a look. I'm very happy, and I'm waiting for that report to go to, so that we can see what we should do. We need to learn. We need to continually learn as we move forward. You spoke about the deepening inequality, and you specifically said in this province, deepening inequality. But it's interesting, inequality has got a measurement tool. It's called the Gini coefficient. And as a member of the ANC, it's probably the last thing that you should raise, a Gini coefficient, when our country has now become the country with the worst Gini coefficient in the world, under the leadership of the ANC. The whole, it looked like on this page, I put a heading on top here, listening to your speech, which had nothing to do with our budget and everything to do with a campaign launch, or perhaps I wrote here a speech that you're going to put forward to address the three branches, because you spoke about Squirrel and everything that he's done and nothing to do with this budget. And of course, the Gini coefficient is really, really concerning. It is very, very concerning. You know that while you were speaking, I was looking at the jobs numbers that have just come out. And let me first talk about our jobs numbers. I really am worried about this, because as a province, we are now, our expanded rate of unemployment is now 30.4%. We've now breached the 30% mark. That is really painful. That is really scary. Of course, our unemployment rate is 28%, and expanded, that's narrow, and expanded is at 30%. But if you want to talk about Gini coefficient, if you want to talk about deepening inequality, if you want to talk about policies that are not taking this country forward to fix the wrongs of the past and to actually find ways in which every citizen in our province, in our country, can find opportunities into the future. Quite frankly, that Gini coefficient linked to a report that we've just seen now on the jobs numbers in the last quarterly report in our country. You just have to look at that graph. It is more than frightening. I'm scared of the 30.4%. There is no other province with an expanded of 30%, up to 40%. The closest expanded unemployment rate is 44%. There are 4 provinces with 50% expanded unemployment rate. That's the real cause of a Gini coefficient that takes our citizens basically down the wrong way. It is not the promises that were made in 94 to the citizens of this country. And it's your political party and your party's policies that are taking us in this direction. This country has the people, it has the place, it has the raw materials, it has the natural beauty, the environment, it has everything going for it that should be the exact opposite of this. But it's your policies that are going to eventually take us all the way down, but it's also those policies that are going to lose you the next election. They're going to lose you the next election so that we are going to have to then start rebuilding this country. Because if you want to say about deeper into inequality, the ANC have really taken us in this country far deeper into inequality than anybody would have ever imagined. You also mentioned that a number of issues or a number of areas in this province where our province is being unconstitutional. You need to roll these out. Challenge us if you may, or if you want to, but also at the same time, I will challenge the Constitution. I will also try new things. I will also push those boundaries because, as I said in the SOPA, we cannot have a diminishing income on the one side and more demand from our citizens on the other side and do the same thing over and over again as a government in the middle and expect different outcomes. We have to do things differently. We have to try things. We must fail in things that perhaps don't work, and we must get up again and we must go and try new things. Because if we don't do that, I promise you, we are all going to crash and burn. And we need to do that. But if there's a constitutional area where we think we're going wrong, that's your job. That's the job of the opposition. That's the job of a democracy. Raise it, push those boundaries. We must either answer it or face the music, but that's exactly what we need to do. But actually give us the detail. Don't just say it. Give us the actual detail. Then you say we are culling African public servants. I want to say to you, absolutely untrue. Untrue. Look at the stats. So what you are saying is absolutely untrue. Take it when I started in government 2.5 years ago and measure now, it is untrue. Absolutely. Then you went on about the Ukraine. So let me say a few words about the Ukraine. Let me say a few words about what is happening at the moment in our Northern Hemisphere, where this party, who's normally the majority in opposition in this province, this party has a whole lot of stuff to say about imperialism, colonialism, human rights abuses. That's what's happening in the Ukraine right now. Imperialism, human rights abuses. And you say nothing. That's unacceptable. And of course, it's not just a straight war that just happened. There was no Security Council, United Nations application. There was no process whatsoever. In actual fact, the processes at the United Nations actually condemned it outright. The United Nations condemned it outright. But you say nothing. You say we go for peace. Quite frankly, right now, your stance as a political party really brings you into question. Because of our past, this country and the ANC should be someone who really understands what it feels like. And you keep quiet. You say nothing about the atrocities that are happening at the moment in the Ukraine. The more than 2 million people.
Will you please take your seat? Honorable Said.
Chair, just a reminder that the Premier ought to speak through you as the Speaker, not address the Honourable Leader of the Opposition directly.
Thank you. Thank you, Honourable Said. Honourable Premier, please address the Chair.
Thank you very much, Speaker. I will speak directly to you, but I think that the Honourable Said and the Honourable Dugmore need to really listen to this, because you say absolutely nothing to the more than 2 million people who have fled to Poland, the more than 4 million people, almost the population of our province who have been displaced and fled their homes. And you say nothing. The bombing of maternity hospitals, the bombing of a place of safety where on the paving outside the place of safety, they write a big thing to say children. Let's try and do that so we at least keep people in this theatre space safe. It's a target. Bomb it. It is unacceptable that you say nothing. You have to stand up and condemn it. Like we all have to stand up and condemn this kind of activity that takes place anywhere in the world. You cannot believe that this is happening in this day and age. And you cannot keep that neutral space. I understand the role that Russia played in the ending of apartheid. I understand the role that Russia played in supporting many ANC apartheid activists, training of military veterans. I understand all of that. But that does not forgive what is happening right now. So then you've got to ask yourself, why? Is this last thing about, actually it's about a whole lot of other deals that are being done between the ANC and the Russians? Is that why? What is it? What has to happen in the world for you to say, actually, it doesn't matter what our relationship was in the past. This is human rights atrocities. These are murders. These shouldn't be happening, and we need to stand up against it.
There seems to be another point of order. Will you please take your seat?
Chair, is the Premier willing to take a question?
We'll take a question after.
Thank you, Honorable Said. The Premier has just indicated afterwards he will take a question.
Thank you very much, Speaker. We really do need to come out strongly against this kind of action in our world, especially us as South Africans. Speaker, then I've got a whole lot of notes here, and of course I'm standing between all of you and lunch. This is the part where I said speech for the three branches because it didn't sound like it had anything to do with this budget. It was about all of these things that Cyril has done, changed the boards, changed the panels, put in investigations, done all of these things because of all of the money that's been stolen by the ANC. But my question is, that's great. Who's been arrested? R1 billion on the Zondo Commission. Who's been arrested? What are the consequences? It doesn't help to put you now take the A team out because they've stolen the money. I put the B team in and they keep stealing the money. That doesn't help anybody. But of course, that was actually the wrong speech for this debate. And I'll leave it at that. I'd like to know who was arrested. But of course, he also spoke about more haste and less speed. Quite frankly, in South Africa right now, we need more haste and more speed. We have to do things differently. We've got to push harder. Those unemployment numbers are shocking. We have to make a change in the citizens' life or lives in this province and in this country, and we have to do it quickly. We have to be decisive. We have to try things, and we have to move forward with speed. You know, it's also interesting, the last point I made on his squirrel speech was we actually need to go back in Hansard because I remember him making the same speech praising Zuma a few years ago, and now he makes another speech praising squirrel. I'm sure the Zuma one was also just before a conference or something like that. I think they were also down to a few branches at that stage too. But Speaker, he then mentions about the new departments, and I must say that I'm very excited about these new departments. He then said without consultation, so I just want to say to him, absolutely untrue. We've been having discussions for 18 months on these new departments. But of course, there's leadership consultation, and then of course there's process once you've enacted it. So at the last cabinet, the cabinet has now passed the process, which puts the timelines in place. And of course, that's when you can't have a whole lot of scenarios consulted with all 87,000 staff in this province. You first got to then say, we are now going through that process. So obviously in the new Department of Infrastructure, of course, which affects directly two departments, but of course will be across all of our governments. So Now we go through the process. It's in the datelines, and that's going to happen over the next year. I also want to say that whether it's the various new departments or some of the changes, every one of them have got a process that is linked to a cabinet decision that was taken last Wednesday, that comes out of the SOPA, that comes out of the discussions that we've been having as a top management and cabinet over the last 18 months. But then the honourable member speaks about the safety plan. And it's quite interesting how many times, and perhaps this is also something that we should do a bit of research on Hansard to see how many times over the last 2.5 years that members of the opposition have stood up and attacked, complained, moaned, done something or said something negative about the safety plan. Speaker, what really interests me, and they keep on saying, what are all the benchmarks and the, you know, in actual fact on the safety plan, there's one. It's halve the murder rate in the next 7.5 years. It was 10. Halve the murder rate. And I must say that as we continually change, as we evolve, as we try new things, as we develop new ways, as we use data differently, that for me is going to be really exciting, how the data gets used differently. And those are lessons from when the plan was put in place 2.5 years ago to now, the lessons from COVID-19 on using a dashboard and data. And I must say to the Minister of Health, Minister Norma French-Mbombo, and her data team, they're outstanding in gathering the data. And as she said earlier in the first debate, how it's actually the health department that feels the pain of trauma along with our citizens, because that's where it ends up. That's where it ends up. So it makes so much sense that when someone is stabbed or shot or some kind of violence, because now it's violence prevention, happens, it gets measured. Whether it's that or the Hectus program that's now administered, 27 hospitals, is it 27? 27 hospitals. I mean, we were quite proud of the 5 that we measured during the pandemic. We've rolled it out now to 27 hospitals where we pick up trauma. That then gets fed back into every department because we need to know where it happened, why it happened, and we can start to deal with it. But that one measurement at the end of the day, one is halve the murder rate. Now, you can't only police your way out of it. You also have to get to the causalities. That's the violence prevention. That is actually the most important focus area of the safety plan and this government. But the most amazing thing for me is that already when Minister Becky Cele stands up in the National Assembly and delivers the history lesson called Crime Stats, and he says in the 11 hotspots in the city of Cape Town where we've deployed the safety plan LEAP officers, it's the only place in South Africa, where there's been a stabilization or reduction in the murder rate. In actual fact, what should be happening is the opposition members should be cheering that along. But no, they are doing the opposite. But we will continue doing what we're doing because the measurements are telling us that we're making a difference. And of course, I mean, I'm still absolutely astounded by our crime statistics every single day. I mean, that's why this plan is in place, because quite frankly, there's no grip or handle on murder in South Africa. More than 3,000 murders in this province every single year? It cannot be. We have to zoom in and focus on it. And in actual fact, we actually need every political party to be joining hands, putting good ideas on the table, really finding ways that we reduce murder, crime, and violence. Because if we want the Gini coefficient to change, sorting out crime is part of that journey. I think I've already answered the issues around the Wi-Fi, because you spoke a bit about the Wi-Fi. But with that, Speaker, through you, can I say again to everyone who's taken part in the debate today, I want to thank them very much. I also look forward to not only in budget debates, but any time. As I've said, we've got to be nimble. We've not only got to be what do you say? More haste and more speed, or less haste and more speed, or more speed and less haste. We need more haste and more speed. In South Africa, we need much more haste and much more speed. And we need it in dealing with unemployment, Gini coefficients, crime, dignity, well-being. All of these areas, we have to make sure that there's haste and speed. And of course, we also at the same time look forward to the further report on that speech to the three branches on the effect of the Zondo Commission, the effect of all of those new boards and investigations, because what we want to do is we want to see the thieves in jail that have been stealing the billions from the citizens of this province. That will also change our Gini coefficient and make a big difference in people's lives if that stolen money ended up in services for the citizens of our province and our country. Thank you, Speaker.
Thank you, Your Excellency, the Premier, the honorable members who also participated in the budget vote. That concludes this budget vote. And of course, we are delayed for lunch. It was best decision to remain and conclude this budget vote. We will break for lunch until 2:30. And I hope the honorable members are in concurrence. And if so, as soon as we're done, we'll then begin with the next budget vote. With that point, I thereby suspend the proceedings until then. Thank you.